Hello, everyone. A very good afternoon and welcome to day 4, which is the last day for PHARMASTEER 2023. Let me thank to all the students for demonstrating your immense love and support for PHARMASTEER 2023, and without which this would not have been resounding success. With that, let us have a huge round of applause for all the students out there viewing and listening to us consistently from day 1 to day 4. With that, I, Ashish Kumar Dubey, Manager Medical Excellence, AstraZeneca, would like to welcome you all to day 4 of PharmaSteer 2023 once again. Today is the day which I'm sure you all must be excited for, since today we do have included topics which would interest you the most. And without any further ado, let us dive into our first session of the day, and that is new drugs and clinical trial rules, what's in it for academic researcher. And for that, we have with us Dr. Padmaja Marathe. With an impressive 25 years career dedicated to medical education, Dr. Padmaja Marathe has excelled in teaching undergraduate and postgraduate students. Her expertise extends to being invited speaker at regional and national workshops, focusing on research methodology, good clinical practice, research ethics, and regulatory guidelines. Dr. Marathe's significant impact also includes 20 years of service on ethics committee, where she has served both as member secretary and chairperson. Notably, she has recognized as a trained international surveyor for ethics committee through the FERCAP and SITSER program. With a remarkable 40 publications in peer-reviewed journals, 18 research awards, and contribution to textbooks on phytopharmaceuticals and pediatric pharmacology, Dr. Marathe has made substantial contribution to the field. Her experience further encompasses leading investigator-initiated studies and regulatory clinical trials as a principal investigator and co-investigator. With that, please join me in welcoming Dr. Padmaja Marathe onto the stage. Ma'am, over to you.
Thank you so much, Ashish, for the kind words of introduction. Very good afternoon to dear students. Before I start my presentation, I would request students to answer 2 poll questions. Handing over to Ashish for projecting the poll questions, please. In academic clinical trials, payment of compensation for study-related injury is decided by. Students can answer. I'll give 10-15 seconds for them to answer. Option A, academic institution funding the study. Option B, central licensing authority. Option C, ethics committee.
So the poll options would be appearing onto your screen. You just have to select the right answer and submit. That's all.
Can we have the second question? Yeah. Okay. Yeah. Second question, please. Compliance with which of the following is mandatory for a postgraduate medical student while conducting an academic clinical trial for dissertation? Options are A, NDCT rules, B, ICMR National Ethical Guidelines, and C, both A and B. Students can please answer. Yes. Okay. I have noted down the responses, dear students. I'll come back to these poll questions a little later. So thank you for that. Ashish, can I share my screen now?
Yes, ma'am. Over to you.
Is my slide visible?
Yes, ma'am, it is.
Yeah. Okay. So we are done with the poll questions. Dear students, it gives me immense pleasure to connect with you all, young budding pharmacologists across India on this platform, and to discuss this interesting topic, new drugs and clinical trial rules, what's in it for an academic researcher. Most of you are aware of NDCT rules and ICMR National Ethical Guidelines, and some of you must have already undergone training as a part of your postgraduate training in your respective colleges. So in this session, I would be specifically focusing on the role of academic researcher in academic clinical studies and the challenges faced by academic investigators while conducting these studies. Now, this topic is actually relevant for all of you. Those of you who are thinking of academic career like me, definitely this is useful. And also, majority of students who would be joining pharma industry and will be on the other side as sponsors. Even for them, this topic is of relevance because they will understand the perspectives and challenges which are faced by investigators in the academic institutions. So this is the objective. These are the objectives of my presentation. At the end of this session, the participants will be able to describe the role of an academic researcher, understand the need for investigator-initiated studies, their importance, scope, what are the provisions for conducting academic clinical trials as per NDCT rules and ICMR guidelines. I would also be touching upon some issues and challenges faced by academic investigators while conducting academic studies, and I will try to discuss some solutions to tackle these challenges, which would be useful to you for your future career. Now, very quickly about NDCT rules, my focus is on academic research and academic researchers, so I'll be just briefly touching upon few aspects from the NDCT rules. NDCT rules, as you know, this is the most important advance or change in the clinical trial regulations in India, which has been introduced in 2019. It's a comprehensive document giving 107 rules, which are contained in 13 chapters. And the rules basically govern new drugs, IND, give the requirements for approval and conduct of clinical trials, BAB studies, ethics committees. The definitions have been specified for new drug, IND, academic clinical trials. Some of the definitions I will be discussing because they are relevant to the topic. Post-trial access, orphan drugs have been defined. The NDCT rules mention the roles and responsibilities of all stakeholders, sponsors, investigators, ethics committee, and also there are penalties defined for the defaulting stakeholders. Clinical trial injury compensation is dealt with in Chapter 6. There are formulae for calculating compensation for study-related injury. And very important that for the first time, there is mention of ICMR guidelines in the NDCT rules, and that compliance with these guidelines is mandatory for all types of biomedical and health research. That is non-regulatory academic study grouped under this umbrella term biomedical and health research. Compliance with ICMR is mandatory. That has been specified in the rules. Now, most relevant or important information for academicians to know is that NDCT rules have made a very clear distinction between regulatory and non-regulatory type of or academic type of research and their respective governing guidelines and authorities which should oversee these research types. So NDCT rules are applicable to clinical trials and BAB studies for new drugs and INDs, whereas ICMR guidelines should be followed while conducting biomedical and health research studies. There are two types of ethics committees which have been described. Chapter 3 describes the ethics committee for CT and BAB studies, that is for regulatory clinical trial, and it has to be registered with CDSCO. Whereas ethics committee overseeing biomedical and health research, the requirements are specified in Chapter 4. And it has to be constituted and it should be functioning as per the ICMR National Ethical Guidelines, and the registration has to be with DHR, Ministry of Health and Family Welfare. So after having given you the overview, let's revise a few definitions which are given in the NDCT rules, which are relevant for my session. So new drug, this definition has been revised in NDCT rules to also include phytopharmaceutical drugs, and there are living modified organisms, stem cell gene therapy. Again, it is coming up in the definition which I am projecting. So all these new types have been included in a new drug definition in ND6 rule. So a drug including active pharmaceutical ingredient of phytopharmaceutical drug which has not been used in the country and not been approved as safe and efficacious by the CLA, that is drug controller. Now the term in NDCT rule is CLA, for Drug Controller General of India. A drug approved by CLA for certain claims, and now companies wanting to market it with a new claim, indication, route, that again comes under the umbrella term of new drug. Fixed dose combination, when the drugs are approved separately, say two antihypertensive drugs separately approved, now company wants to combine and give as market as FDC, or if there is change in ratio of ingredients of already approved FDC, or there is change in indication, route, dose or dosage form of FDC, again it is labeled as new drug. So all these three categories, 1 to 3, are considered as old drugs after a period of 4 years from their approval. There are two more categories included in new drug definition. Category 4 is a modified or sustained release novel drug delivery system, or vaccine, monoclonal antibody, living modified organism, stem cell, gene therapy product, etc. These two categories specifically, they are always termed as new drugs for lifelong, irrespective of the period since their approval. Definition of IND is also given in NDCT rules, means a new chemical or biological entity or substance that has not been approved for marketing in any country, and it is proposed to be developed as new drug for the first time. That is considered as IND. Definition of clinical trial is also given, and you have to understand that NDCT rules, the clinical trial term is specifically used for indicating new drug and investigational new drug testing. That is, when research studies are done to test new drugs or IND, the term clinical trial has to be specifically used. And regulatory trials, basically regulatory research studies are clinical trials. Okay. So the definition includes that it's a systematic study of new drugs or IND, which is done in human subjects to generate data regarding the pharmacodynamics, kinetics, properties, safety, to evaluate its safety and efficacy. So you will understand that clinical trial, IND, new drug, everything comes under the oversight of NDCT rules. The other term is biomedical and health research, which has been added in the NDCT rules, in the regulations. Simply, it means the research other than clinical trials involving new drugs and IND. Okay, all other types of non-regulatory academic research comes under the umbrella term of biomedical and health research. It is a research which is basic, applied, operational, primarily done to increase the knowledge about diseases, your prevalence studies or drug studies which are done on old existing drug to find out efficacy of two drugs for a condition. The studies done for prevention, diagnostic tests which are compared, or devices, surgical intervention. All these types of studies which are not regulatory clinical trial as defined in NDCT are included under biomedical and health research studies. Now, academic clinical trial, the definition has been given, and also criteria for review and approval has been specified in the NDCT rule. Academic clinical trial is a trial of an already approved drug for a certain indication. It is initiated by academic researcher or the academic institution for new drug, new indication, new route, dose or dosage form. And the results of such study are intended to be used only for academic or research purpose and not for the intention of marketing the drug or, getting the data on the drug promotional material. So this is very important to understand that it has to be initiated by the academicians and it has to be for non-commercial interest to test the off-label use. The criteria which has been given in NDCT rules for academic clinical trial, no permission for this is required from the central licensing authority. So get this very clear, when it is a non-commercial academic clinical trial done for the research purpose, for academic purpose, there is no permission required from the regulators. Okay, so it has to be done for academic purpose and it has to be initiated after approval of EC. The observations should not be, or the result should not be submitted to the CLA, Central Licensing Authority, and observations are not used by any company for promotional purposes. So this is very clearly written. Then who has the oversight on academic clinical trial? It is the ethics committee and it comes under the purview of ICMR guidelines. Okay. But however, whenever ethics committee has doubt on the nature of study, or ethics committee feels that probably this is a new drug or it's a very high risk study and there is intention of the pharma company which is giving educational grant to use this data for marketing. If there is any doubt or nature, ethics committee, who actually is the quasi-regulatory for ACT, will inform the regulators within 30 working days of receiving the application. And there are tight timelines for regulators also to respond. They have to respond within 30 working days. And if there is no communication received by EC within 30 working days, it will be presumed that no permission is required from the CLA. Okay, so these are the timelines for all the stakeholders to respond. And academic clinical trial, as I said, it has to be conducted in accordance with the ethical principles specified in the ICMR guidelines. So NDCT rules have specifically mentioned ICMR guidelines and local ethics committee to be quasi-regulatory for overseeing the review and approval of academic clinical trial. Now, this 30 days timeline is given for regulators to fast track the approvals. However, sometimes regulators do not respond. one of the ethics committee on which I am serving, one study was communicated about one study. Ethics committee had communicated to regulators. It was a high risk study, and ethics committee waited for 30 days. There was no response, and ethics committee gave approval to the PI. But however, reply from regulators came after 3 months, and there were queries for the PI. So the study had to be halted till the PI resolved the queries, and then again approval was reissued by ethics committee. So these practical problems also occur, but this was in 2021, but now with Sugam portal being compulsory for all the communications between the stakeholders, things are better. So this is about the criteria which I told you. Now, just to highlight the importance of ACT, how it is important and academic investigators should undertake ACT, I have picked up some example from literature of studies done by academic institutions. This is a study where metformin used with anti-TB drug for faster sputum conversion. Melatonin has been tried as chemoprotectant in head and neck cancer. These are the two published studies. This Tibolone study I have picked up from CTRI, where it has been tried in depression in postmenopausal women. And another study from CTRI is low dose hydroxyurea versus normal dose in sickle cell disease children in India. So these first three studies which I have shown, they are for testing off-label indication or new indication, whereas the fourth study is testing off-label dose in pediatric practice. Now, pediatric practice, there is a lot of scope for testing and validating the off-label use, because almost 50 to 60% of practice drug use in children is off-label. So there is a lot of scope, and pharma companies are generally hesitant to invest in drug trials to validate the off-label claims, because obviously because of the low revenues such studies generate, or the results will generate. So now, having told you about the definitions and the provision of ACT in the guidelines, let's look at the role of academic researcher. You all will agree that academicians, they form the backbone of medical colleges, and they have multiple responsibilities. They shoulder multiple responsibilities like engaging in patient care, they have education, a lot of administrative duties. But according to me, the most fulfilling or most demanding yet fulfilling duty is to be a researcher in academic institution. There is a lot of scope, freedom and opportunities to pursue research in your area of interest as per your specialty. And being an academician, you are at advantage because you are continuously teaching and learning, and that helps you to update your knowledge. There's scope for research publications, promotions, and patents, and you can build your reputation as well as your institute's reputation. Two ways you can engage in research is by planning investigator-initiated academic studies, as well as you can be a part of regulatory studies and non-regulatory studies which are done by industry. So even pharmacology department faculty and residents, they are involved. They are approached by pharma company, and they are involved as co-investigators or co-principal investigator along with clinicians who are subject experts, and they are usually very busy. So roping in a pharmac department faculty and residents really helps in smooth conduct of studies. So pharmacologists also, this is very important. Now, a little bit about investigator-initiated academic studies and their importance, and why academic research should undertake such studies. As the term suggests, it is initiated and managed by academic researcher or a group of researchers. Okay, and they initiate, plan, conduct. So they are sponsor and manage overall. So they are sponsor investigator, they are called as. Such studies are designed to address the questions that clinicians face in their day-to-day practice regarding their patients' need. And some of the areas, interesting areas of research is like they can conduct ACTs to generate evidence for off-label use. They can compare existing drugs, devices, pharmacoeconomic, real-world evidence studies, genetic. There is lot of scope. You can also do studies on innovator versus generic and biosimilar versus biological. And the main problem when to undertake these studies is the funding, which I would be discussing in detail later. But uh, uh, very often clinicians, from academic institutions, they ask pharmacology department some queries like, can I use this drug in a patient having compromised liver function or compromised kidney function? What are the drug-drug interactions when multiple drugs are used? Some of the answers are not known. You can actually take up these research questions and do academic studies, and which can contribute crucial evidence to the data which is already known on those drugs. And academic studies, when they're well designed and of good quality, they can really contribute to formulating health policies. Now, some examples I have picked up from literature of landmark, highly influential, practice-changing academic studies done by group of academic institutions. A Scott LLS study showed that atorvastatin treatment causes reduction in non-fatal MI and fatal CH3. This was a study which was actually terminated early because of the highly favorable results. And atorvastatin, as you know, is used in primary and secondary prevention since then. PEP study, which has been published in Lancet, recruited 17,000 patients undergoing hip fracture, and here also aspirin was used, and it showed that it is effective in preventing pulmonary embolism and DVT. So like that, you should be motivated to undertake good quality academic studies. Now, I'll just briefly touch upon the role of academic research in regulatory clinical trials, because this is not the main focus of my topic. Academic researchers, they can, in collaboration with industry, as a part of regulatory clinical trial, they do contribute to innovative problem-solving research. It is commercially rewarding, and it fetches revenue for your department and institution. But investigator is bound by the provisions of NDCT rules here, and there are conduct of clinical trial described in Schedule 3, and there is undertaking by investigator wherein an investigator agrees that he will comply with all the rules, GCP, and conduct the study ethically. Site SOPs are mandatory. Of course, all these aspects should also be done by academic researcher while undertaking academic studies. But here in this case, investigator is directly accountable and responsible for whatever actions or no actions he does. So non-compliance and misconduct, there are penalties defined ranging from just giving a warning by regulators to rejecting the clinical trial study or withholding the permission, or withdrawing the permission, to the extent of debarring the investigator, that is also possible. But industry is very vigilant, and they keep on doing auditing, monitoring, and educating investigators. So there is a lot of hand-holding, so these problems do not occur, but it can happen. So you have to be aware that the responsibilities are far more when you are a investigator with regulatory studies. Now, just discussing about the provisions as per NDCT rules regarding oversight of biomedical and health research, that is non-regulatory academic studies. Rule 16 and 17 have clearly mentioned that this comes under the purview of ICMR, and ethics committee is the oversight authority for these non-regulatory academic studies. So ethics committee has to be constituted according to ICMR guidelines, and it has to be registered. Very important that EC has to be registered. So you will understand that regulators have handed over the baton to ethics committee to oversee the conduct of biomedical and health research and non-regulatory and academic studies. So what are the provisions now? Henceforth, I am discussing some provisions in the ICMR guidelines, because academic research is mainly under the purview of ICMR guidelines. So ICMR guidelines clearly mentions that financial arrangement is the headache of investigator or institution. Investigator can pay from pocket, or institution can have some corpus funds, or investigator can apply for intramural as well as extramural sources. Like there are DBT, DST, ICMR, a lot of investigative initiated studies, research grants are there by these government agencies. So investigator or institution has to make provision, including the provision for insurance coverage and compensation, because the guidelines also mention that that has to be provided. Then a budget, when is planned, there should be a provision for including insurance and compensation. PG guide and institution should take up the responsibility for PG students. This is a statement in ICMR guideline. The guide is responsible. So many ethics committees, they make the guide, PG guide, as PI, because PI is supposed to communicate and also give compensation in case an interventional study is undertaken. The lack of funding is a major deterrent in academic research. Although there are great ideas and good quality research questions, funding poses the major constraint, and that has to be arranged. So it was interesting to look up the sources of funding for academic studies for me. So I just found this interesting article by Bhide and others from my department. And they found in their study that the autonomous research institutes and their affiliated hospitals, the number of studies registered from them are the highest, followed by government funding agencies, government medical colleges, and the least number of studies were registered from private medical colleges and private hospitals. So research institutions, I think institutions like Tata with the hospital and PGI, which is a research institute and a college, they are registering their studies, and they are getting a lot of intramural funding. So I think there is a lot of encouragement to academic research in these studies. So other colleges also should follow and create intramural funds for their academic researchers. Regarding the compensation, the provision in the ICMR guidelines for academic research is same as that of NDCT rules. that medical management should be free and compensation should be provided. But here only ethics committee is responsible for deciding the relatedness of SAE and determining the amount of compensation which is required. And you can look at the clause regarding the decision on compensation. It mentions that to decide compensation for research-related injury, ethics committee should consider the aspects like type of injury, extent of injury, loss of wages, etc. So this gives a clear idea that ICMR guidelines have kept this provision a little vague, and they have left it to ethics committee to decide, which creates dilemma in many situations. Now, some glaring issues in academic investigated initiated studies. Research constraints I have already discussed. No dedicated time is there for the researchers with a lot of other responsibilities. Research is the last priority. Lack of knowledge about the guidelines, how to conduct ACTs, regulatory provision. The academic researchers, the faculty as well as junior faculty and postgraduate students, they don't have training. So my experience as a ethics committee member is that the academic studies get maximum number of queries and sometimes protocols have to be revised. So sometimes they don't come back, when queries are sent on compensation, what is your source of funding? There's no reply because academicians, he has great idea, but he does not have funds. So this is unfortunately the reality. SAE's deviations are not reported. There is no compliance with GCP as expected from academic investigators. This is sad, but this is the reality. No internal auditing and monitoring mechanisms are there in the institution like it is there in the regulatory studies, and a sponsor is always sitting on your head to monitor. The challenges in payment of compensation, EC though is responsible, there is, as you saw the clause in the ICMR guidelines, there is no clear-cut guidance or mechanism. So ethics committee reviewing both types of studies, what they do is they have common SOPs and they calculate compensation as per the NDCT rules. And then investigator of academic study, he has to plan a study budget and have the insurance coverage provision as it is required for a regulatory study that increases the study budget further and again creates problem in getting procuring the resources for funding. So a word about industry academia partnership for funding academic studies. As I said, intramural and extramural sources, one of the extramural source which investigator can approach is industry. And industries are more than willing to support academic researchers by giving them educational grant only for academic purpose. And they give partial support, like they provide gift samples, study drugs or investigations or some logistic support, statisticians help or protocol development help. And usually this is done purely with academic interest, but rarely, very occasionally, there can be a hidden interest for data ownership or publication, joint ownership for publication or using the data of the study for promotion. So investigator has to be very clear and make an agreement with the sponsoring industry to ensure the non-commercial interest, and there should be clauses in the agreement which have to be which have to be reviewed by the ethics committee legal expert also, that there is no commercial interest and investigator will be the sole owner of data and there won't be any future commercial use or promotional use. So ethics committees also have to be trained to look at these agreements. Now, again, the study by Bide et al. Also looked at awareness of academic researchers regarding the academic clinical trial. So knowledge, attitude, practices of ACT among 100 academicians across 3 institutes in Mumbai. This was found out, and the findings were quite glaring that 89% said that they were trained, but they had 41% only had conducted at least one academic clinical trial, and less than 50% could correctly answer the questions related to documents rated for approval, the authority for decision making, etc. So there are also challenges in funding and EC approval process which were reported. So this study highlights the need that academic researchers really need capacity building and intensive training. So I also looked at with interest to find out how many academic studies are registered in CTRI over the last 3 years. I found that academic, the bar chart which shows the bars in blue part shows academic interventional studies. So I could see that there is a slow rising trend of academic interventional studies which have been registered in CTRI, and they are more in number as compared to academic observational studies. Okay, this could be because of lack of awareness, and sometimes students and the faculties, academicians, they feel that only interventional studies need to be registered. Actually, registration, as you know, is very important and relevant for everybody in the field of academics, because registered studies give you an idea about where the research is heading in your area of specialty. I also looked at, I took the data from our paper regarding CTRI registrations of only medical PG thesis in 1 year, that is 2019. And I found that only 5% around theses were registered. There were so many 35,000 seats of specialty and super specialty, and only 1,700 around had registered. But most of these again were international studies, and anesthesia department was quite active in registering studies in that year. 16% only had looked at off-label use. So this data tells you that a lot more is expected from academicians as well as PGs, and off-label drug use studies should be undertaken. Last two slides on my suggestions to overcome the number of challenges which I have discussed. The administrative authorities in medical colleges should offer intramural funding. There can be a competition, the research societies in the academic institutions, they can give funding on merit basis for good quality studies, or risk stratification in academic studies. High risk studies which are good should be given more budget. Incentives, monetary benefits to faculty for undertaking good quality research studies. Their conferences, attending conferences by them can be sponsored, and other incentives can be provided. There should be dedicated time for research activities per week. This would really help the academicians, and this is done in many universities abroad, that 2 days of a week or few hours of a week are dedicated for research. Clinical research department and unit should be established in medical colleges. That would really help in arranging training program for faculty and PGs, supporting manpower, employing clinical research coordinates or biostatisticians. That would really help. Advanced training is definitely required for faculty as well as PG. The external agencies, extramural agencies can extend support, including pharma industry, but there has to be a proper agreement and no commercial intent. And this guidelines and regulations should actually provide some guidance to academicians on this account. Training and capacity building of ECs to be able to review academic studies, ACTs, MOUs, funding and budgetary provision always should be looked at by the EC. And lastly, I think that higher authority NMC should give directions to medical colleges through universities and make it mandatory that intramural funding should be there for academic research. This is especially in view of the fact that NMC has made the publications, presentations, and by postgraduate students mandatory. It's a criteria for getting criteria for appearing for your MD and MS examination. So NMC should make it compulsory for institutions to arrange support. So that was my last slide. So with this, I would like to end by quoting Dr. Albert Zent Georgi, who is a medical biochemist or Nobel laureate, who had said that research is to see what everybody else has seen and to think what nobody else has thought. So postgraduate students should develop this research attitude during their formative years, during their postgraduate training, by undertaking good quality academic studies, even for thesis. Thesis should not be looked upon as just a requirement for passing MD. And you should undergo intensive training. There are many options open now. There are many online research. And I'm sure many students must be already doing that. Those of who not doing, I am just suggesting this. NDCT rules have got clarity, have given us clarity about the type of research studies, regulatory, non-regulatory, the oversight mechanisms. However, more guidance is required for some of the challenges which I discussed. So more guidance from the regulators and ICMR is needed to tackle the challenges which are faced in the academic studies. So thank you very much. These are the references which I have used for making this presentation. I am really sorry for overshooting my time. Can we have the poll questions quickly, and maybe 1 or 2 questions from students? If that is okay. Over to Ashish. Extremely sorry for overshooting.
No problem at all, ma'am.
Yeah.
You're right on time. Yes.
We took extra time for poll questions, so I thought that I can take.
That's perfectly
Yeah.
fine, ma'am. So we have our first question.
Students, please. Yes. Right. So in academic clinical trials, payment of compensation for study-related injuries decided by students can answer one of the options. The number 2 question is compliance with which of the following is mandatory for a postgraduate medical student while conducting an academic clinical trial for dissertation? Which guideline to be followed? NDCT, ICMR, or both? Can we? Yeah, so the first question answer is 75%, which is correct. Actually, the compensation for study-related injuries decided by ethics committee, but I don't know why 25% have still answered academic institution funding. Academic institution just provides the funding, but the decision, the keyword was decided by is ethics committee. And I'm happy. Earlier, the response was 55%, and now it is 75%. Can you show the second question, please? Yeah. So second question, the answer expected was B. Oh, still there is confusion in students' mind. Here, the compliance is mandatory with ICMR national ethical guidelines because it is an academic clinical trial, which is completely under the purview of ICMR national ethical guidelines. NDCT rules have mentioned, in fact, that ICMR guidelines should be complied with. Okay, so the answer expected was B here, and some students still had doubt after listening to my presentation. So I hope they have now understood. Yeah, thank you so much. Thank you for your patient listening.
Thank you so much. Thank you so much, Padmaja ma'am, for being here with us and elaborating the importance of NDCT rules that are there for the benefit of students. We do have received a couple of questions from the students, though, and I would like your views onto them. So the first question is, are there any noteworthy differences between NDCT rules and international guidelines, and how should researchers navigate these variations?
Yes, so it would be really difficult in a short time span to give the differences of NDCT rules versus the international timelines. But one uh, main difference which I can tell you is NDCT rules mention the formula for calculating compensation for study-related injury as well as study-related death. And India is the only country, as far as I know, which has come up with this formula for compensation. There are a number of other differences. And okay, one more I can tell you is the local clinical trial waiver, which has been granted in case the drugs are already approved in other countries and the drug is to be used for life-threatening disease or a very serious disease, and where in cases of areas of unmet need, the regulators give you local clinical trial waiver and give you permission for marketing, but they also ask for post-licensing studies when such drugs are given expedited approval for marketing. There will be a lot of other points which I think it would be, but the question is really good, and I urge the students to look up for the important differences between the developed countries guidelines and NDCT.
Thank you so much, ma'am. I do have one last question to you, and which is, how does NDCT addresses the inclusion and protection of vulnerable populations in clinical trials such as pediatrics or elderly participants?
A separate section on vulnerability and protection of vulnerable population, it's not there in the NDCT rules as such, but NDCT rules very clearly mention that the GCP guidelines have to be complied with, Indian GCP, and all the provision for vulnerable population, research on them, and the safeguards to be implemented is mentioned in the GCP guidelines. So you have to interpret it that way, that whatever is mentioned in the Indian GCP guidelines have to be followed, and that way those aspects are covered in NDCT.
Thank you so much, ma'am. Thank you so much for being here with us and steering us through 360 degrees of NDCT rules, which I'm sure would benefit the students for sure. With that, let us now move forward to our next session, and which is cracking the code, the art of interview preparation. And for that, we have with us Ms. Priyanka Thakur, Talent Acquisition Lead, AstraZeneca. Ms. Priyanka is a seasoned HR leader with more than 15 years of proven track record in diverse industries such as information technology, software services, research and development and engineering, science and technology, and apparel, fashion, and retail. Ms. Priyanka is a hands-on leader with a blend of strategic perspective and operational excellence. Priyanka believes in creating a win-win situation for all her stakeholders, evident in multiple HR programs and solutions that she has led. Priyanka has led teams in the areas of strategic workforce planning, talent acquisition, leadership hiring, campus recruitment, organization design, job analysis and evaluation, compensation and incentive structure, talent management, as well as learning and development and HR business partner enterprises. With that, let us have a huge round of applause for Priyanka. Priyanka, over to you.
Thank you. Thank you, Ashish. Thanks for the great introduction. And good afternoon to all of you. So as Ashish mentioned, I am the talent and development lead for AstraZeneca in India. And very true to my portfolio, I'm going to talk about two things with you all in the next 20 minutes, and then keep maybe 10-15 minutes aside for any questions that you may have. So the part that we are going to touch upon is that how do you put your best self when it comes to one of the important moments in your life, which is an interview, right? That you're very interested in, or the role that you're very interested in, or maybe the company that you want to work for. Now we do have a slide, do have a slide deck, but we are mostly going to speak about just two things. Okay, number one is the power of you. And number two is that how do what are the different kind of interviews that you come across? What are the smart tips and tricks to crack them? But I'm not going to make it a kind of a monologue. I would request each one of you, I can see a couple of names like Priyanshi, Jagdish, Sandhya, Rakhi, all of you to please unmute and try to answer the questions as and when I ask you. Okay, is it doable? Is it doable from your side?
Priyanka, so this is our vendor team. It is telecasted somewhere else right now.
Oh,
So
sorry,
they,
sorry.
yeah.
I'm sorry. I'm sorry. So, is there a way that they can write it on chat, Ashish?
Absolutely. They can comment.
Okay, great. So let me know. Okay. So next slide, please. Okay. So here is a photo, and what if I ask you to pick one person from here and describe that person? Will it be possible for you to do? It'll not be, right? So how much ever you try to pick up one person, max maybe you'll be able to describe them is by the color of the cloth that they're wearing, but not really from a perspective of saying, who the person is, what is the image that the person put forward, what are their strengths, what are their areas of focus and things like that. You'll never be able to do it because it's a crowd out there, right? So what are we trying to do, or what are we trying to say here? We go to the next slide. What we are trying to talk about is that, yeah, kindly move. Yeah. So when it comes to an interview, what you need to do is you need to stand out of the crowd. You see, if you have to pick one person from the crowd and describe them, it's not possible. We saw, right? But when we are able to find out our core identity, what do we stand for? What is our personal image? How are we different from others? Then we are able to stand out of the crowd. So how do we do that? That is something that we can see in the next slide, which basically speaks about what is the challenge, your own identity. How do you discover your identity? Now, when you speak about your identity, there are a couple of things that you have to remember. Number one is we do have a detailed slide on how do you talk about your identity and things like that. But before that, remember this one word, which is very, very important. When we speak about your identity, it is very important that you bring your authentic self forward. That means that whatever you are, what is your natural confidence, what are the natural characteristics you have, and not something which is fake. Just because you think that the fake image is better, it's not about that. It's like, how do you first become comfortable with your authentic self? You discover that authentic self and you bring it forward. Saying is easy, but when it comes to discovering and displaying it, it's quite difficult. But we'll speak more about it. Let's go to the next slide, please. So the first thing that we need to talk about is how do I differentiate myself and how do I show my brand? Could you go to the next slide, please? Next slide. Yeah, this is very, very important. Who you are, right? So when we speak about career per se, the first question that you need to ask is, what excites me, right? What do I absolutely love doing? What is that one work, even if I have 100 other things to do, and that one work or that one area of task that comes to me and I get very super excited about it. So that's your area of interest, right? Then the next thing that you need to focus on is that how do I like to work? That means personality wise, how do I like to work? For example, if you ask me that, how do I like to work or how do I relate to others? I thrive in an environment which is very collaborative. So for me, taking people along to a larger common goal is something which I absolutely like. But when you see a lot of other colleagues who will say that, I like when, there is an individual contributor's work, because, I can bring my expertise, I can decide, how do I do the work. So the working style of people is very, very different. There are people who thrive in competition, then there are people who thrive in collaboration, right? So number one is what excites me. Number two is how, when a work is done, it excites me, right? So please try to answer it for yourself also, as and when we are speaking. And the third thing is, and this is where we're going a little deeper into the skills and abilities and everything. Okay. What are the natural talent that you have, and what are the acquired talent you have, because of which you can do a task or a project or a work very, very easily. And this is what we mean by skills and ability. Natural talent is the core, deeper personal characteristics that you have, which may or may not be very easily trainable. That means, for example, if somebody is creative, right? You cannot pick up a non-creative person and try to train them to become creative. It's quite a difficult task to do. It's not a trainable activity or trainable skill, right? So we are speaking about your natural talent, your personal characteristic, which is deep rooted, either because of the kind of ecosystem you have come from, or the kind of family environment you have come from. You all will have a natural talent. So please try to understand what it is. You'll find there are people who are extremely disciplined and very good at completing a large goal by breaking it into pieces, because they are so disciplined, right? They know that after 1 year, I have to crack this exam. So they know each day, every day, how do I, prepare for that exam, and they never falter in their plan. So discipline is a natural talent that some people have. Discipline cannot be taught to somebody. So that's your natural talent, right? Acquired talent is that in the process of academics, or in the process of doing projects or meeting people, you would have acquired certain talent. For example, in the corporate world, you will see there are people who acquired the knack of how to manage a team. None of us are born with it, right? When you're maybe in academics, when you're part of clubs or you would have done some projects, you would have found that informal leadership role that you would have played. But when it comes to corporate world, you will see that there are people who are individual contributors, and then they have to transition into people management. So that's known as an acquired skill, right? For example, in a student's life, an acquired skill will be that I'm academically very good, I'm theoretically very good, but I've slowly also acquired how to give good presentations, right? So that's an acquired skill. So please do a little deeper thinking. There are a lot of other points that we can talk about, but I want to limit it to 3 important points. What is your interest area? How do you like working with people? And are you aware of your natural talent and acquired talent? So if you understand Venn diagram, you see that these 3 circles are meeting in one place, which is known as a career sweet spot. So there are people who are very lucky and they get to do what excites them, right? Then there are people who may not be so lucky and they have slowly fallen in love with what they do. But the idea is that if you are not either ways, if you don't like what you're doing, you'll never be able to create that sweet spot for yourself in career, right? So these are the 3 things that you have to keep in mind. When you understand this, what you are, how you like to work, and what are the skills that you bring to the table, you are slowly getting closer to your core identity, because each of you will have a different answer for all these 3 questions. So the more you do deeper understanding of this, you will be able to understand what is your personal brand. Okay, let's move to the next slide, please. Okay, now once you have understood your personal brand, right? There are 3 things that you should keep in mind. If you want to build a brand, right? For example, if I want to build a brand for myself that, I'm good at collaboration, I'm good at bringing cross-functional teams together and working for a common goal. If I want to do that, then I have to do more of that, So you have to do that behavior more. That means you have to display your behavior on a daily basis more, so that slowly that brand gets built. Just by saying, I know my core identity, this is what my natural self is, this is what I'm good at, that's not enough. People have to understand that, right? So this is about also the ability to display those things that your personal brand is about. Second one is definitely leverage your strength. It's most of the focus generally goes into things which we are not good at, and we try to develop ourselves a lot in that. But what I have realized over a period of time, a lot of people have shared with me that in that while in course of doing that, they kind of stopped focusing on their strength, and I think that's the biggest disservice that we can do to ourselves. You have to know your strength. You should know how to leverage your strength. Areas of improvement is important, but it should not be that I only focus on what I'm not good at and try to build that and forget about how to sharpen my saw when it comes to my own strengths. So that's equally important. Know your strengths and leverage them when you're building your brand. And very important, it's you need to build up that confidence to tell people about your passion and strength. It's not an easy task. Our culture, our value system, it tells you to be humble. It tells you to not speak about yourself. People don't like hearing that. But believe me, when you're your authentic self, people just love hearing about other people's passion. I mean, I still know a lot of entrepreneurs that I have heard, and when they speak about their vision, it is so exhilarating to hear that. You all would have heard people, when they speak about why they established a business or what they want to do in life, you get engrossed, right? Because it's lovely to hear about people's passion. And people get engrossed. Okay, so these are the three things I want you to remember, that once you have understood your core strength, by answering those questions, you have got closer to your core strength. You need to display that behavior which helps you in building or accepting by others, that yeah, this is the person's personal brand because the person consistently does this, right? Second is, do not forget your strengths when it comes to to build your personal brand. And last one is, do not hesitate to speak about your authentic self and your passion, because the more you speak about it, the more people hear about it, you will get closer to your personal brand. And this is one way that I have found people differentiating themselves. Okay, I just want to leave you with this very easy tip. Could you please move ahead on the slide? Now, in today's world, right? This is the world of digital natives. So when we speak about branding, it's equally important that we also leverage social media. So keeping your online visibility is very, very important. Uh, when we speak about online visibility, one of the ways that you can create your corporate personal brand is LinkedIn. And there are a few tips that I wanted to leave you with when you are trying to look at your LinkedIn profile. If you can move to the next slide, please. So social media, like I said, is very, very important. It's one of the most powerful tools that we have today in the noisy environment, the cluttered environment that we live in, that when somebody walks through your LinkedIn profile, as and when you're preparing to create one, or maybe you already have one, So the first thing is that you should have a LinkedIn profile. Once you have created a LinkedIn profile, you will find LinkedIn is a very nice marketplace to share your interests, share your common passion, etc. So there are a lot of interest groups that you can add to yourself. You can also add further details to your background, like what is your interest area, what do you volunteer for, what are the extracurricular activities that you are interested in, because then people understand the full-fledged you, right? Profile picture, please do not ever discount the power of this profile picture. I still remember, I was going for an interview with this very, very known entrepreneur, and the person has been successful in creating not one but two successful startups. And when I was going through the person's profile picture, you'll not believe, that this male leader was holding his daughter, in that profile picture in LinkedIn. And that image has always stayed with me. So the first feeling that I got is, okay, this person understands the value of work, but also understands the value of life and family. That profile picture was so powerful because it's not something that you generally see in LinkedIn. And I felt that the person is authentic. It's just he's bringing his authentic self to the to the table. So please remember that profile picture is a very important part of your entire profile. Once you have done that, as you transition from the campus to corporate, or otherwise, you know that there are certain companies that you have heard about, you may have experienced, or people who are close to you have experienced, and you are really gung-ho about working with them, right? So when you search for those target companies, go through their profile, look at the kind of jobs that they have advertised, and take a note of the graduate role specifically and the keywords which are used in the ads. You will understand when you see the lot of companies talk about the kind of person that they are looking forward to. There are companies for certain roles, they will say that I'm looking at somebody with a strategic mindset, creative mindset. Then there are certain roles where they will say not only strategic mindset, but I'm also looking at somebody who is able to execute things well or balance it out, right? So so an ad which says we need somebody with a strategic, creative thinking mindset is very, very different skill than an ad which says strategic mindset is important, but execution is also important. That means the second role is actually trying to balance out two very different skills, like kind of dichotomous thing. One is a thinking skill, one is a doing skill. And execution is whether somebody is able to conceptualize, but are you able to execute on that? Execute to the T, to the perfection. So please read those keywords properly, because you will understand that what kind of skills are valued, how are those companies evolving, if they are about to launch an important product or a business unit, you will also come to know from their LinkedIn profile. Second important thing, and I think most of us do it, is that once you have understood the company, you also try to see what are the kind of profiles of employees who are already working in those target companies, which are the kind of degrees they have undertaken, what projects have they done, which other companies that they have worked for, and how many years have they stayed in this organization, because that will help you in understanding about those target companies better. And if you have mentors or anybody that you look up to, please feel free to go to them and say, how can I make my LinkedIn profile better? So with this slide, we kind of take a pause with the first point that I wanted to bring about, is that the power of you. That means the power of authentic you. And believe me, your authentic you is the most exciting self that any interviewer or any employer would like to see. So this is where I take a pause. Ashish, would you like me to take questions if you have received questions now, or should we take it towards the end?
I think let's take at the end, because we are collating the questions from the students right now, Priyanka. Yeah.
Sure.
Yeah.
So this is the first point that we wanted to drive, that how do you first understand your authentic self and how do you amplify it further for the world to see? Now let's take the next step. Next slide, please. Yeah, it's just a funny cartoon which talks about, IKEA job interview. You can see that that the interviewer has asked the interviewee to enter, and he's saying that please have a seat, right? And you can see in order to take that seat, the interviewee has to assemble those, right? So and it's an IKEA job interview. What better way than this to conduct the interview? So please, next slide, please. So with that cartoon, what I wanted to bring to your notice is the types of interviews that you can expect. Okay, so the number one is a very standard one. It's a traditional one that we all have heard about, but slowly it is kind of going out of vogue. The traditional one says it's a 101 format. Focus is mostly on qualifications and whether the person with those qualifications fits, right? And it's a direct exchange. The purpose of the interview is just check the fitment of the person. So preparation tips will be, you research the company and the role. You try to answer some of the common questions that they ask, like, what are your strengths? What are your areas of improvement? What is the best project that you have done? Which is the subject that is closer to your heart? And there may be some, questions around it. And definitely you dress professionally, and that's kind of common for all the interview format, that you need to dress professionally and arrive on time. Second and third one, they're not much difference, but let me take it one by one. But second and third one are slowly gaining more and more visibility in the interview practices. Second one says that qualification is good, I know, qualification is good, and everybody who is from that college will have the same kind of qualification. But I'm not going to only look at qualification, I'm going to look at the deeper aspect of behaviors. Because when I understand how you have behaved in the past in certain situations, maybe I'll be able to predict your future performance, right? So the famous saying among interviewers is that recruitment is a gamble, right? You talk to a person for half an hour and 1 hour, you try to understand whether the person will do well in the role or not. And hence, slowly we're shifting only from qualification to behavior, because if it is a gamble, then I would like to win the gamble by ability to predict the future performance of an individual. And hence, there is a lot of focus on skills and behaviors and less on qualification only. Okay. The best way to crack an interview of this kind is to remember this technique called STAR technique. Very simple. Most of the questions will be around, in your past, have you ever come across a situation where you had to take a stand different from the majority in a room, right? Because what they're trying to assess is, do you have the courage, right, to stand up for something that you believe in, right? Have you ever come across a situation where initially in the project you had very difficult time, but slowly you kind of overcome the difficulty and had a very good impact in the project? What they're trying to see is that, how do you take up a challenging task and complete it, right? So they're trying to assess from your past behavior, uh, how can I say that the person is if my company believes in people's ability to take a stand for the right reason, then I would like to assess somebody's courage. And looking at qualification, I may or may not be able to assess that, right? And hence the STAR technique is, whenever you are thrown a question like this, first thing is that you need to be honest, because the questions will further go deeper, probing style. When you're honest and you found a situation in your life where you had shown that courage, or maybe where you have shown that great, let's say, project management skills. Okay. So you describe the situation, and that's the first S in the STAR. You describe the situation. What was the situation about? You describe what was the task about, right? So you will say that, I was given this project, which is not my core area. My specialization is this, but I took up this project to learn something new. And the situation was that I had to work with experts in that. Task, what exactly was the project goal, right? Then what action you took and what was the result. So the best way to answer either in behavior or situational interview is that you need to think from a STAR methodology perspective. If you don't think from a STAR methodology perspective, I've seen most of the newbies or new interview givers fumbling, going around the bush, talking about a lot of things, but no answer coming out, right? Situational interview is also similar. They will kind of put you in a situation and they'll say, tell me, how will you solve it? So it's slightly hypothetical than high behavior, because it's mostly like saying, I give you a situation which is very closer to common situations in life or workplace, and I'll see how you behave. So not much difference. Behavioral is really, it has something happened to you in the past and you have behaved. Situational is may or may not have happened, but I've given you a situation. I want to see what is going to be your reaction and response. In both the things, it's very, very important that you are honest, number one. Number two, you also understand what's the job description about, because job description tells you what skills they are looking for, right? So it's important that when you're talking about the STAR technique, or when you're talking about the result in STAR, you bring those aspects around. Very important that you have also done a little bit of self-reflection, self-conversation, to understand what has been the past experiences of yours that you want to speak about. That kind of a homework is something that you have to do. You can also do a little bit of industry challenge research, because most of the question or situations will be around the challenges that industry is facing, right? And like I said, the biggest challenge that I see is that people know the answer, but they are not able to articulate the answer. And that's why we are saying that the STAR technique is something that you can look for: situation, task, action, result. Yeah. Let's go ahead to the next slide. Most of the time, you will see that you will go through a technical interview. So technical interview is kind of a functional interview. So if you have applied for a data science role, I'm just giving an example. If you have applied for a medical liaison officer's role, the questions will be from those subjects itself, right? So this is generally a single interviewer, and it's generally a technical round, which we call. This is where your hygiene factors of the subject, of the knowledge, theorems, frameworks, whatever is attached to those technical concepts is generally tested. And it's kind of a deal maker or deal breaker, because it's a hygiene factor, right? That somebody who does well technically and is able to show the other softer skills, like we said, problem solving skill, collaboration, discipline, etc., will is somebody that we would like to bank on, right? Most of the interviewers will have that kind of a mindset. So technical interview to large extent is a gating criteria, very strong gating criteria. Then you move to manager interview, your direct manager's interview. Sometimes the technical interviewer is also your direct manager. Okay, this is where you will find most of the softer aspects of your behavior getting checked. Are you a good team player? What is the way you think? Is it a structured thinking process? Do you have creative thinking, critical thinking, problem solving? Those extra added important competencies are tested here. If you have a technical and manager interview kind of clubbed together, you will also find in many organizations manager plus one. That means your boss's boss, that roles, the boss's boss will also take an interview. Even the boss's boss interview will 80% focus on software aspect and maybe 20% on the technical aspects of the job. And the last one is HR Connect. And that's why we use the word HR Connect. That itself should give you this idea that if you have cleared the technical and manager interview, and in some cases manager plus interview, you're almost through. Because HR Connect is mostly about the cultural fit, decent communication skills check, and very, very important, where the person fits into the salary bracket, what are the expectations, what will we be able to meet the expectations, and so on. So this is the interview. These are the interview rounds that you generally come across. Just last couple of slides. Next slide, please. So these are this kind of self-explanatory, but if you have to learn what is the technical skill, how do you learn or how do you brush your technical skills? You need to definitely understand the course and project clearly. You need to focus on the solution of the problem, whatever the technical problem which is given, right? Those kind of things which are focused on. There are also a learning ability which is assessed in manager interview, because you're not hiring. Most of the interviewers will say, we are not hiring for today's job, we are hiring for tomorrow's job. That means not only you're able to do the job that is in hand better, but you also look like somebody who has potential to do the next role, right? And when it comes to the next role, they generally check the learning ability. So if today the person has 3 years of experience, and once they complete 5-6 years of experience with us and we give them some kind of a role of this kind, will they be able to create will they be able to concentrate, create the effort? Can they be self-starter in learning new opportunities, new skills, and so on? And attitude, I think this is what we generally call as a cultural fit. Attitude means whether the person's personal values and organizational values, they are matching. The person is a team player, and has positivity in the communication and so on. Mostly, this is basically what we call as a culture fit. Next slide, please. Okay, this is just a very funny diagram. Just take a self-check. So on this sheep scale, how do you feel today? So it says, there are days when you're feeling like the sheep number 7, not very happy, right? Then there are days when you feel like the sheep number 9, you're very, very happy, you're jumping with joy. Then there are days when you feel like a sheep number 4. You just don't want to talk to anybody. You want to just go and hide, right? Whatever your sheep scale may be, on the day of interview, and the next slide, please, it's very, very important that you put your best self forward. Could you please move to the next slide? Yeah. So before I go into before and after, let's concentrate on the during. And during the interview, the first thing that you have to remember, and that's why I wanted to show you the sheep scale, whichever number sheep you feel like, it's very important that on the day of interview that you have a very positive impression, right? Positive impression generally is said that 70% of your impression is made by your body language, right? And that's where offering a firm handshake, maintaining eye contact, the verbal cues, non-verbal cues that you give is important. Active listening, very important. You have to listen to the questions properly. You need to answer not only with clarity, and I think not only clarity and conciseness. That's why we spoke about the STAR technique, so that you don't go around beating the bush. You answer what is looked at. But I'll also add one more C here, which is known as conscientious. That means your answers also need to be honest. Please respect the interviewer. They have many years of experience, and that's why they are on the other side. If you give a fake answer, it's very easy for them to catch you, because they will go deeper. And most of the behavioral or situational interview that we spoke about, they have this probing methodology, that they go at. If you have any question in your mind, and a very important question which will help you in understanding the organization better, definitely ask it. People love when they see that somebody has done research about their organization, or are interested in the organization or future of the organization. That's definitely something that you should do. And we all, I don't think we need to tell you this, but the closing part of should also be graceful. Before and after, it's there, you can go through it. I really don't think you need this detailed understanding from me. But very important is that you, from a before perspective, I think it's very important that you do the homework right. So if you are thinking of the STAR methodology, create certain situations and see how you want to answer it, right? So next slide, please. In today's time, you will also see that maybe you'll have to sometimes, take a virtual interview, right? Other than a dedicated workspace where there is not much noise, it's very important to check your network bandwidth. If you have roommates or family, maybe you should set some ground rules about with them, or maybe close the door. Be aware of what your background is. If you think the background is not good, maybe blurring it is something which we would recommend. At the same time, ensure that your video is on, because it's about impressions, right? If an interviewer is talking to you, they would like to see you as much as you would like to see them, right? And like we all make this mistake. Even after so many years of usage of it, we sometimes speak on mute. But be careful of that the person doesn't have to ask you again and again to unmute, right? And etiquette, be your natural self. I don't think you need to control your facial expressions to that extent. Be your natural self. Be your pleasant natural self. Maintain eye contact. Don't have this slouching. I've taken interviews where people have sat through the entire interview in a slouching manner, and it doesn't give a positive impression to the person. And if you have bandwidth issue, maybe it's important to let people know in advance that you may face bandwidth issues, so that the interviewer who's coming to your interview doesn't have, is prepared, informed, so that if there is any fluctuation, they are able to manage it. So that's the last slide. And next slide, I just want to say thank you to all of you for listening. And also, very importantly, all the best. At the juncture that you all are in, I think best wishes are very important.
Thank you so much, Priyanka, first of all, for being here with us and sharing the detailed insights around the art of interview preparation, which I'm sure is going to benefit all our audience who are MD pharmacologists, young MD pharmacologists, and are looking forward for the interviews around the corner. We do have received some questions, and I would like your response to that. The first question to you, Priyanka, is what role does non-verbal communication play in interview success, and how can candidate enhance their body language and overall presentation?
Yeah. So I think, see, um, this is one of the important moments of your life, right? in the next couple of years, whether it's an online interview or an offline interview, this is a very important moment in your life. So you have to accord the same priority to what and how you are dressing up, how you are presenting yourself. At the same time, when I say dressing up, I don't mean that you have to buy the most expensive shirt or the most expensive blazer. That is for the day when you earn the first salary, But clean shirt, iron shirt, polished shoes. If you are comfortable in a tie, feel free to wear it, because that always see it's when you are dressed up well and you go for the interview, they it's not being shallow. Okay, what it means is that you have paid, you are dressed up well because this is your way to show respect to the company and the interview. So remember that, like, how am I dressing for the occasion is not, it's not about me and my fashion sense or my shallowness. It's about how much importance have I given to you and the occasion that you have invited me for. Remember that. Okay, second thing is non-verbal cue. If I would have come for the presentation today in a slouched manner, uncombed hair, not smiling at all, would you like to listen to somebody like that? No, right? So remember that the way you want to hear others, that's exactly the way people want to hear you. Third very important thing is there are people who are introvert, then there are people who are extrovert, then there are people who have better fashion sense, lesser fashion sense. So please remember that you have to just bring your honest self. If you are faking it, you will not be able to sustain it for a really long time. Okay, so you don't have to copy anybody else's style of talking or copy anybody else's style of dressing. You just have to bring your authentic self. And if something goes wrong, it goes wrong, right? It can happen to any one of us. We may spill something on our shirt and all. Be your natural, confident self. So that's I what and non-verbal cue has a strong role to play. Whenever you have listened to different kind of speakers, there are speakers that you love, then there are speakers you may not be able to connect a lot. What is the biggest difference other than the content? Think about it. Then you will understand how important non-verbal cues are.
Yeah. Thank you so much, Priyanka. So my next question to you is, and I'm sure that you have touched upon this point in during your presentation, and the question is, could you share some insights around handling challenging or unexpected questions during an interview and how to maintain composure under pressure during that time?
Yeah, yeah, it's a good question. See, generally nowadays, you will not see organizations doing stress interview. There was a time when stress interview was a very common practice, but it's no longer done because it also, I don't think it's right. Organizations would like to put that kind of an branding for themselves. Okay, so real term stress interview doesn't really happen as such. But at the same time, you may be asked a tricky question. You may be asked a question that you don't have an answer for. First thing that you need to do is if you've done honest preparation, 90% of those questions is something that you will be able to. I now, I'm speaking with 16, 17 years of experience, having gone through so many interviews in my life, in my college days, B school days, and later in the corporate world. The interviews that I have really sat through and written notes to prepare, 99% of the questions were something that I was able to answer, how much ever difficult it is, right? Because you'll be able to do that. So prepare well, do honest preparation. Very important to write it down, the points that you want to speak about, because the more you write, right, there's this study which says the more you write, the more you remember. It's not about taking those notes to the interview. Because you've written it, you'll remember it on the day. So do that well, because then you'll have less of those critical questions or difficult questions. And if there is a difficult question that you cannot really answer, just accept it. I mean, maybe with a smile. Or you may also, there are people who have said, I really don't know the answer, but let me give it a try. So that's another way to open the conversation. That means you're not very sure of the answer, but you are somebody who are enterprising enough or involved enough to give it a try, right? So do that. Just because you're not sure about the answer, don't hesitate in answering. These are a couple of things that I would say you do.
Thank you so much, Priyanka. My third question to you is, can you share some common mistakes that individuals make during the interview preparation and how can they be avoided?
Let me not, okay, common mistakes. I think people don't research about the organization well. in this age of digital, I think many of the information are out there, right? Either in the company's website or Wikipedia or press releases. People don't do that, read that. I have taken finance interviews where where people have not even gone through the annual statement or the P&L of the organization. How do you think it, so that's I think it's a very, very bad impression to give the very first go. Vis-a-vis a person who comes and says, hey, I went through your website and I heard that you're doing these kind of projects under sustainability, and it's a point which is very close to my heart. So I have worked with fashion industry earlier, and there are people who come and say, I really believed in recycled clothing, and these are the brands I follow because it's about recycling. They recycle clothes, and your company is also talking about sustainability. And from there, the conversation became very positive. So I think prepare well, understand what the organization is about, what their purpose, what their value is, because it will put you in the right spot. People don't do that homework enough. It sounds very easy, but it doesn't happen a lot. I've also seen that you can get a sense of a person whether they have done the homework when you have asked questions. We have asked questions from hostel life. We have asked questions from academic life, and I have seen people not being able to answer that. That means it's not that they have not experienced, they have not done that self-conversation or self-reflection there. Third mistake, and a very commonly done one, is fake answers. Please avoid them. People are on the other side because they have many years of experience than you. They will probe, they will ask you for more details, and that's where you'll start fumbling.
Thank you so much, Priyanka. Although we are overshooting the time, but I feel that this particular question is something which is important and would be useful for the students. So after an interview, what steps do you recommend candidates take for self-reflection and improvement, regardless of the outcome?
A very, very good content. So shows growth mindset. Huh? The moment you said regardless of the outcome, how can I think you will be able to understand where you did well and where you did not, right? When you have experienced an interview, whatever area you could not do well, write it down and see how, if you ever come across that question again, you will, you will answer that. There are people who would have gone through 2-3 interviews, and happens a lot when you go through B school placements, right? Because those placements are like in consecutively 2-3 days, and they write down the questions that the people have asked. What are the commonly asked questions? So they have a question bank of 50 questions or so. I've seen people doing that, coming back and writing the important questions which were asked. Because that helps you in preparing. And then for the next interview, you just go through that question bank and how will they answer, which project will fit into which question, which situation will fit into which question. These are a few self-reflection things that you can do.
Sure. Thank you so much, Priyanka, for being with us and sparing some time with us over here and addressing to all the questions coming across from the student patiently. Thank you so much, students, for amazing questions, and Priyanka for equally amazing answers to them. Thanks a lot for that.
Great. It's very exciting to always, although I didn't get a chance to really talk to, but it's always exciting to come to a platform where you have the younger generations. It's always more energizing. Thank you so much.
Thank you so much, Priyanka.
Bye.
Now, moving on to our next session, which is a panel session on prescription of success, the power of networking and partnership. And for that, we have with us 3 great individuals who have flourished throughout their careers. And let me invite onto stage our first panelist, Dr. Hardik Vasnawala. Dr. Hardik's professional journey has been marked by a trajectory of excellence and strategic impact within pharmaceutical industry. Commencing as a field medical advisor, he expertly connected with opinion leaders, ensuring the optimal execution of medical strategies. Progressing to the role of senior medical advisor, Dr. Hardik not only expanded his responsibilities across a broader region, but also took on a pivotal role of mentoring new MSLs. With over 3 years of dedicated service in this capacity, he transitioned to a strategic role in medical affairs, overseeing diverse therapy areas such as diabetes, cardiovascular, and primary care. Dr. Hardik's pivotal contributions to AstraZeneca include playing an instrumental role in designing strategies for the blockbuster brands, collaborating closely with cross-functional teams. Currently holding the esteemed position of Associate Medical Director, International CVRM, Dr. Hardik continues to demonstrate his commitment to advancing medical science and pharmaceutical strategy on a global stage. Let us join in welcoming Dr. Hardik on stage.
Thank you, Ashish, for that grand introduction. I don't know well deserved or not, but thank you. And very happy to be here. Hi,
Thank you so
everyone.
much, sir, for being here. Our second panelist is Dr. Kavita Varghese. Dr. Kavita, a seasoned professional with over 5 years of dedicated service at AstraZeneca, currently holds the esteemed position of Senior Director of Oncology Medical Training in Cambridge, England. Her journey with AstraZeneca began as Regional Medical Advisor in Cardio-Renal Portfolio based in Mumbai, India. Dr. Kavita has consistently ascended the ranks, contributing significantly to the organization's global impact with strategic focus on driving medical capability building and digital innovation in medical affairs. Dr. Kavita's leadership has been instrumental. Her progressive roles include International Medical Excellence Lead, Medical Excellence Associate Director for the International Region, and most recently, Senior Director of Oncology Medical Training Global. Through each role, she has played a key role in shaping the landscape of medical affairs and fostering innovation in ever evolving medical affairs. Dr. Kavita, welcome onto the stage.
Thank you very much, Ashish, for that very kind and detailed introduction. But I hope the hype is not too much. Thanks.
Thank you so much, Dr. Kavita, for being here with us. Let me now invite our third panelist, Dr. Sachin Joshi. Dr. Sachin Joshi, a seasoned professional with over 12 years of extensive experience in pharmaceutical industry, currently holds the esteemed position of International Associate Medical Director at AstraZeneca. In his role, Dr. Joshi showcases a wealth of expertise in medical marketing, partnerships, pharmaceuticals, product launches, market access, and approvals processes. Before his current role, he served as therapy area lead for respiratory in Bangalore, contributing significantly to the strategic initiatives and demonstrating leadership throughout his career. Dr. Joshi has also consistently showcased a deep understanding of pharmaceutical landscape coupled with a proven track record of navigating complex processes. Dr. Sachin, a very warm welcome onto the stage.
Thank you, Ashish. A lot of superlatives. I liked it.
Thank you so much. Let me thank all the panelists for being here with us today. And Dr. Hardik, my first question goes to you. How has networking played a pivotal role in your pharmaceutical career, and what advice would you give to MD students entering into the field?
Thanks, Ashish. First of all, thank you for the invite and I think amazing program. I was looking at the agenda specifically for this session, and some of the topics are very interesting. I heard the previous panelist also for 15-20 minutes and very useful tips for interviews even for me at this stage. So congratulations in setting up this program. And I'm sure I think in the audience, everyone is getting maximum out of it. Now coming to this topic like networking and partnerships, I think very two key words and very key to the success, I think, in any career, I would say, and more so if you are planning to join a professional career in, let's say, pharmaceutical industry or any corporate world. So let me focus on the networking. So this is something like which we don't pay too much attention in our studies, like whether undergraduate or postgraduate scenarios. We have books, we read them, we understand them, we omit them in a paper or in a viva, and we get great marks and we are bright students, which is good. Now everyone competing for a career in a corporate organization, this is a bare minimum requirement. So everyone would have this much knowledge, degree, qualifications, everything. But what matters in the corporate world is like your ability to influence people and your ability to drive people forward in a cohesive way, because it is a very complex interconnected structure. Once you enter into the big organizations, you would understand that while you might work for a medical affairs, but you have to deal with several other work streams, functions, departments, and then make sure that you are able to work with each other and then reach to a common goal. So in that sense, I think networking is critical for two aspects. One, getting the work done. You might be super efficient and you can do your bit of task, let's say in 10 minutes or 10 days. But then it is interdependent on 5 other work streams and 5 other leaders. So you have to communicate with them, network with them, explain them the requirements, and then they support the project and your projects get delivered. So networking is critical for your overall project delivery, your key achievements, and your success. Second is for your personal growth. Like if you want to move to the next stage, and then the next stage, and then the next stage. As I say, everyone will have talent, everyone will have skills, and that's a bare minimum requirement. It's given. What matters and what adds value and make you stands apart for your next role will be your ability to again network with the people, have those right connections, and everyone understands what value you brings in and what strengths you have and how you can contribute to the overall success of the organization. I would also caution, it doesn't mean that you keep overselling yourself to each and every individual you come across. I don't think that is a networking. But in a professional way, letting people know what you are capable of and what your strengths are equally important. And that will make sure that you get your deserved credit and deserved return in terms of professional growth as well. So I really feel, I think networking is something which plays a role in a corporate world, and that is something which we need to pay attention and learn. And this is, I think, the right stage where some of you are aspiring to be joining any career. I think even if you go to a clinical practice, I think networking will still matter. But I feel since I'm in this part of the world, I think here it is of great importance, and you should start maybe reading about it, having conversation with your friends and your peers, and maybe your colleagues who are working in this industry, and start getting some knowledge and then applying it in your day-to-day life as well. Yeah, I don't know if my other panelists have to add something to it.
If I could just follow in on what you were talking about, Hardik. I think what Hardik was getting at is you don't need to do networking always with an agenda in mind. Authenticity is a huge deal, and people can easily see and sense that. So, even in my personal experience, sometimes the networking aspect does not even need to be about, I mean, the conversation does not necessarily need to be about personal growth. It could just simply be an exchange of ideas. And what happens is when that networking happens, another person who was not aware that you had these ideas suddenly becomes alert to the fact that, okay, here's a person who has different ideas and who has some things that could be potential solutions for a larger organization, or the scale at which we can actually implement the solutions that this person is thinking of is something that we would want to have. And to be very frank, all the different roles that Ashish just listed out that I had happened because of meetings where ideas were exchanged. And they were just exchanged with people not I'm directly reporting to, but from a broader sense. And that's when they picked up the fact that some of the solutions that we are proposing in India or in international, all of these could be scalable. And that's how I was able to reach the next level. So coming back to that point of the networking bit, think of it as creating your realm of influence, but also it's a great opportunity for you to just simply exchange ideas to just be better at your own work. And then a byproduct of that could potentially be the career growth that you've been aspiring for.
Thank you so
Yeah,
much.
I just wanted to add to that, so one more perspective of networking is visibility. And, if you see everybody is busy in their own tasks, they have to finish their KPIs, etc. So they won't be actively looking into who is doing what unless somebody comes to them and tells them that I'm doing this kind of thing. So it is very, very important that we understand this. Sometimes we come across in the organizations, people say that I've done so much, but nobody is appreciating that. But then people don't know because everybody is busy in their own tasks. Unless you show them, nobody is going to come to you and ask. That is one part where networking helps you pretty much, that you have casual conversations, you have, as Kavita was saying, then people get to know that this is the person who is doing this kind of things, these ideas, and I good to know that And then the things start more that where can this person fit in my work area, and how we can collaborate. So that is one. And second part of networking is listening, because many a times we are very keen to share our own thoughts, etc. But it's very, very important. People like to be listened. So I like to be listened. That's why I keep on talking. But then it's vice versa as well, right? So if I listen to people, they like to talk, and from that collaboration improves.
Ashish, you're on mute.
Sorry. Thank you so much, Dr. Hardik, Dr. Kavita, and Dr. Sachin for that insightful response to the question. And in line with the same, Dr. Kavita, my next question goes to you. Sorry, I think.
You're audible, Ashish.
You're
You
audible.
can
You're
go on.
audible.
Sorry, there was some technical issue. Yeah, Dr. Kavita, my next question goes to you. So the question is, in the evolving landscape of medical affairs in pharmaceutical industry, how do you see the role of networking shaping the future of the industry, and what trends should MD students be aware of?
Right, that's a great question. So again, going back to the part of exchanging ideas, that is primarily why people lean on networking these days, because the tendency to stay in silos is definitely being broken down. If that's one thing that I've constantly heard since I joined AstraZeneca, is that break down the silos. What that essentially means is that people are beginning to develop a more interdisciplinary way of working, not just for ensuring that the end product is the most viable one. And the end product could not just be the drug, it could just be a solution for patient experience. It could just be, even you would have noticed that a lot of pharmaceutical industries are now going from a pill to platform kind of a view, where we're trying to be even giving technological solutions or digital health solutions so that the patient experience is better. Now, to do that, a medical affairs professional cannot just simply stay in the medical affairs lane. You need to know about other industries and what works in other industries and what can be adapted from that and brought into ours, because there is proof of success there, so you don't need to build something from scratch. And this requires you to talk to different people from very diverse backgrounds. And then trying to have that strategic mindset to figure out the synergies and what can be adapted. So that interdisciplinary approach is now becoming an increasing trend, especially since we are going for more innovative AI, including solutions in some instances. So that is not a luxury. What I'm trying to get at, it's become more of a necessity, because you simply cannot have all the information that you want just from reading books or just from going on a bunch of YouTube channels. Sometimes having conversations with experts in different fields give you what's called tacit knowledge. Tacit knowledge is something that is coming from your experience and not easily found in that explicit sense when you're reading a book or when you're seeing a YouTube video. But the key to success sometimes lies in those little nuggets of experience, and you have to have conversations for that, and you need to network for that. And you also need to have to know how to build meaningful relationships. It's not, and very true to what Sachin was saying, it's that visibility factors is important, because sometimes not just for your own progress, sometimes it's just that another person knows that you're working on something and they tell you, you know what, I've been working on the same thing, or somebody else has been working on the same thing. So then you get to know that, okay, there are several people within the same organization trying to solve for the same issue. And then you learn from each other, you learn from each other's mistakes. It becomes much larger than what you actually originally started out with.
Thank you so much, Dr. Kavita. Dr. Sachin and Dr. Hardik, may I invite you to add your views onto the same question?
Yeah, maybe I can add something. Could be a repetition of what Kavita said in different words, but to stay relevant and to stay updated, you need to learn. I think one way of learning and a traditional way of learning in the student life is a book. But once you get out of that education system and comes to a working environment, a simple coffee conversation with someone can also be a learning, right? There is a quote which says that life itself is a learning. So if you are having a conversation and exchanging the ideas, you will learn faster. You will not get outdated like that Nokia phone. You will be updated, and that will help you keep a pace with a future trend, which is evolving at a very rapid scale everywhere, more so in a pharma world. So I definitely think it's relevant today, and it will be more relevant going forward.
Yeah, I'll just add one sentence, like you find your way through networking, because things are changing. If you want to be relevant, and if you want to be, finding your job always interesting, then once you network, you think, or you get some ideas that, okay, this is something that this can be my next step in my career. Otherwise, the same group of people, you will keep on doing same things, and you will get tired very soon.
All right. Thank you so much, Dr. Kavita, Dr. Sachin, Dr. Hardik, for sharing your thoughts around that. And that brings me to you, Dr. Sachin. In line with what Dr. Kavita and Dr. Hardik shared, we all know that the partnerships are crucial in medical affairs. So can you share a case where a strategic partnership positively impacted a pharmaceutical project, leading to successful outcomes?
Yeah, so we just need to look at first why partnership and what is a partnership basically, because so there are a couple of principles of partnerships that we need to take into account. So first is that there should be common interest, because many a times in pharmaceutical industry or in any other walk of life, we think that, okay, I'm interested in this, let me go and propose, and we start working in collaboration. But you don't gauge properly if the other person is equally interested in that. Therefore, it's very, very important that you have common interest for partnership. So if the interest is not there, then first you inculcate that, develop, and then start your partnership proposal. Because otherwise you're stuck, because you already propose, you go ahead, you invest, and then you find that the other party is not much interested. Then you're pushing the other party to work according to you, and then you're spending your energy and nothing comes out. So very, very important to have common interest for partnership. Second is you should have visibility, at least like when you're talking about partnership, you should have long-term visibility that what is the plan and how it is going to develop, and does it fit into the partner's plan? Because in any business, for a business to grow, the person you're catering to, they should grow. So then only your business will grow. So this is another principle of partnership that you should keep in mind. So you should have a whole year plan at least and understand if it is going to happen. Third is that sustainability, like you can't keep on investing in partnership endlessly, right? Partnership is at some time it needs to take up and be sustainable by itself. So automation, like Kavita was saying, AI, etc. And automation is very, very important in those in today's world for that. And scaling up finally. So your partnership is first step. And partnership, when you do is your purpose is that you can scale up things, right? So you come together with people, and then you can scale up things. That's why is the idea of partnership. So these things should be planned in advance. Then only you can go ahead with partnership, and then partnership actually gives rise to something very good and useful. Now, some of the examples that we have is, for example, in severe asthma, where I work, the identification of severe asthma and appropriate management is very crucial. Many patients are suffering from oral steroid use for their asthma attacks, and they're not being managed properly. So this is something that we have been talking about to many doctors. Frankly speaking, some of the doctors tell us that we have been using low-dose oral corticosteroids, and we are happy with that. So you don't over-stress on the steroid usage and side effects, etc. These are not going to be our partners immediately, right? So we need to understand that. What we did is that there is an expert center of excellence in UK, which is Guy's and St. Thomas Hospital. This is associated with NHS, and they have maximum patients on advanced therapy. And they have so many publications coming out of that. And they're very interested in research on biologics and which patients exactly these biologics should be used. So we went ahead and we asked them that AstraZeneca has this new portfolio which is coming up. You are pioneers, or you have most experience in this. Would you like to partner with us? We'll do these scientific things. And this is how our plan will develop further. So with this, that center became a partner with us. And now we have expanded the networks of severe asthma centers of excellence across international markets, around 14 countries. And we have more than 60 centers. So we started with 8 centers, and now we have 16 centers of excellence, 60 centers of excellence for management of severe asthma across different markets, including UAE and Taiwan and Latin America, etc. So this is what this has helped us is thousands of patients are being screened. There are people with common interest which have come up. A community has formed with doctors, and now they're coming up with different publications, papers, or different strategies so that the severe asthma patients can be managed very easily, or there can be simpler tools to identify them, how we can enhance the reach of this identification, diagnosis, appropriate treatment of severe asthma, and then benefit the patients. So this was one of the examples. This is called as International Severe Asthma Network, ISAN. And they keep on having, every month we have now a complex case discussion where doctors enthusiastically participate. The doctors send the cases, like from India, some of the doctors send cases. They give the whole history. And this case is discussed amongst all these international faculty. And they find it very, very interesting. So this is how it is developing, and it has a lot of future plans to enhance it.
Thank you so much, Dr. Sachin, for highlighting the importance of partnership and sharing a wonderful example with us. Dr. Kavita, Dr. Hardik, do you have anything to add on to the importance of partnerships?
Maybe a quick one. Partnership is critical because you are not a Rajnikant. You can't do things on your own. You need to partner with multiple stakeholders in multiple areas and subjects to become successful. And I think this program is a good example of partnership between the university and AstraZeneca, where we are trying to arrange a program which helps you get the initial knowledge to prepare you for the success in the future. And at the same time, we would also love to see some of the bright chaps joining the AstraZeneca or likewise other organizations.
I think Hardik stole my point, but
Sorry.
no, but it's just one soft skill side that's like I wouldn't call it a word of caution, but the great thing about partnerships is, like Sachin rightly alluded to, we find a common goal for the patients. It's about the patient's experience. But like Hardik mentioned, we want a new crop of MD pharmacologists coming up and being industry professionals, but not just industry professionals, people with a real purpose. So the goal is always good, and what we do need to understand in partnerships is also the motivations might be different for both sides, but the end goal is the common goal that we are all working towards. And there would be situations that, because of the motivations being different and the different pressures that people have within their own ecosystem, you might not always have to agree on everything with the partner. And I'm pretty sure that Sachin and Hardik would have been in those situations as well. But what's very important to remember in those situations is that as you navigate those conversations, which I promise you will, it's very important to remember, always lead to a win-win conversation wherever possible. There would be non-negotiables, and that's always the case. But if you can actually ensure that the core group of people that you want to benefit out of them and keep them at the forefront of your thoughts, you will both be able to come to a solution that actually makes that the most viable, sustainable, in Sachin's words, sustainable and scalable project or solution that you could come up with.
Kavita, I am on a partnership where I don't agree on anything. That's marriage.
Your wife's watching this? Good.
I'm alive.
Lovely. Thank you so much. Thank you so much, Dr. Sachin, Dr. Hardik, and Dr. Kavita for sharing your thoughts around partnership. So we are talking about the example. So my next question is to you, Dr. Hardik. Can you share a specific example where a partnership or a collaboration significantly contributed to your professional success in the pharmaceutical industry, sir?
Yeah, sure. I think difficult to pinpoint at a specific example, as all of us are discussing. This is an essential skill and tool for you to survive, grow, and expand. So maybe I can share these two perspectives. One is like, let's say, my objectives or my projects, where I need partnership to make sure that the projects are successful and they deliver the end objective. So sometimes we do partner with and bringing external expertise into the project, like let's say working with an IDF, which is International Diabetes Federation, or likewise other organizations, and then joining forces to achieve a common objective, as Kavita was sharing. Like the end objective needs to be same. IDF might have their own way of working and their own agenda and the projects. AstraZeneca would have their own way of working as well. But if the end objective is common, which is helping type 2 diabetic patients to improve the life and prevent the complication, then the partnership would work. It would be sustainable and we would be able to make progress. So that kind of finding the right partner, which has a common end objective, and then working with them, leveraging each other's strength, has helped a lot in delivering many projects over the years in AstraZeneca. So that's one example. Personally, I think for my professional growth and career advancement, uh, again, this collaboration with people have helped me. And as I was saying in my initial comment, like you need not to oversell yourself to the individuals and to the stakeholders, but at least they should know what strength you are bringing and what capabilities you have and how you can help the broader organization. So having that collaboration with various stakeholders across the level has helped me in moving forward in my career. Maybe a confession, I never passed any interviews except the first one where I entered into AstraZeneca. Then it is always about people backing me, people knowing my strength and capabilities, and then giving me an opportunity. So I think that way my career itself is a good example of how successful collaboration can help you advance your professional growth. Yeah.
Thank you so much, Dr. Hardik. And in line with the same, Dr. Kavita, I do have somehow similar question to you as well. Could you elaborate on a challenging situation where effective networking helped you navigate and overcome obstacles in your pharmaceutical career?
Well, when you say things like challenging situation, it's always those instances that would be like, oh my God, I'm in trouble, sort of a thing. So yeah, I have come across a few, and one of the most recent ones, I guess, I had to organize a workshop for a large group of people, and in the last moment, I couldn't. The speaker bailed out, and it was a very niche topic, and I started searching online, and and it was very last minute. I think it was 3 days before the event, and and this is something that you would recognize once you get into the pharmaceutical industry. Organizing events, even such as these, and we have to commend Ashish and the team behind this. It's not the easiest because there are so many moving parts behind it. And then if something as significant and visible as a speaker does not turn up, then your entire project and your project management goes out the window. But what happened was that I was able to tap into my network and then essentially send out an SOS call. Oh my God, this thing happened. I need to find a replacement. I have got 3 days. It's a very niche topic, and I need somebody who can actually do a good job and should not come off as a last minute replacement. What happened was one of my network partners finally came through. Like I put out the SOS call to so many people, but one of them said that, I think I know a person who knows a person. And she tapped into her network, found me a person who was so good that I was glad that the first speaker bailed out. And it turned out to be an even better event. And this person, again, was very keen on building that network. I'm still in touch with her, the new person that I found. She's a new friend who, again, in situations where I need to be bailed out of, I can reach out to in a pinch, and I know that she would come through. And it's always great to actually have people within your network who you can have those SOS calls with. So that was one event that went brilliantly just because of a networking situation.
Wow, that is so great. I totally echo with you on that, Dr. Kavita. Thanks a lot for sharing that. Dr. Sachin, I would come next to you. So networking often extends beyond professional circles. So, how have personal connections influenced your career trajectory in medical affairs, and what lessons can students draw from these experiences?
I think it's more the personal connections that help you rather than your just professional networking, in any part of life. Because professional is something like uh, you just work together and then you forget. And but when you want to grow, you need friends, you need feedback, you need suggestions without being judgmental, and all those things can happen at work when you go beyond your professional limits and you be friends with some of the people, and then they come up with, okay, I think you should do this, or likewise. Otherwise, professionally, everybody will not express to the same extent and will not share the ideas. So I think it is very, very important. It has helped me quite a lot in my career. The most important thing, again, I would say, is it's a continuous process. So developing a personal rapport is beyond professional. It's a continuous process. You keep on engaging with those people. You keep on sharing different thoughts which are beyond just your professional. And then it doesn't need to be, when you develop those personal relationships, it doesn't need to be that you need to be in contact with that person every day, but you will have such good bonds with that person that you will, anytime you contact, like after a gap of 1 to 3 months, still the person is ready to help. So it's always very important, and it's always very rewarding also to have a go beyond professional and then have some personal connections. You feel the ease at work while doing that very much. Otherwise, the situation sometimes may become very, very pressurizing, and you can talk only that much to somebody. So it has helped me quite a lot, I would say. While I was on my India role, I had very good connect with the international team, who was having different kind of requirements, etc. And as Kavita said, I was sometimes a savior for them. They had some difficult situations and they reached, and I was one of the people who helped them. So that also, I would say, that also helps, that people start seeing you as friend, and then they would say that, okay, this person can really help. This person knows, and then things move, which is just beyond the professional way of working. So extremely important, helps pretty much.
Thank you so much, Dr. Sachin. That brings us to almost at the end of our panel discussion. I do have one more question upon which I would need views from you, Dr. Hardik, Dr. Kavita, and Dr. Sachin. Any final piece of advice to the students out there upon networking and partnership?
I can
I would
start.
say,
Go ahead.
sorry. Okay, thanks, Hardik. I would say be genuine and authentic, and I would rather agree with Hardik that you don't need to oversell yourself, because that shows up, and then it will show up like you're trying to contact and connect each and everybody at very high level, and then you try to smile, zabardasti ka, and shake hands and all, which shows up, and it sometimes looks like they feel pity about that this person is trying very hard and it is showing up in a wrong way. So be very authentic, be very genuine. If you don't feel like, I don't want to network right now, that's fine. You don't need to be forceful to yourself, but authenticity really takes the things long way.
Yeah, maybe quick one from my end. As Kavita, I think, was mentioning, that it needs to be a very casual chat without any agenda or without any end objective in mind, with an open mind to share and exchange ideas and learn from each other. Everything else would be a byproduct of that conversation which you will have every day in and out throughout your long career. The professional growth, the project achievement, all deliverables, exceeding achievements, everything. So as long as you keep doing that and keep getting better at it, I think that would be very useful.
I think Sachin and Hardik touched upon the most important bits. so I don't need to talk about that. But what I would actually tell everyone is that you do need to realize that there is effort in this. When you're actually setting up meetings with people, you are asking them their time. So you need to be respectful of that. And also you need to consider that sometimes the companies themselves would give you networking opportunities with certain programs, but there is effort in that, especially when you're thinking of time that goes into it. So you need to be willing to invest that time to build a relationship, which is exactly what Sachin was alluding to. Sometimes you may not have the bandwidth to do so because you've got so much going on, and you need to make that judgment call on when is the right time for you to start building your networks, because once you start building them, you also need to maintain them. It's like after a while, your grandparents or your uncles keep asking you, you never call me anymore. So that's fine when it's blood relations, but when it's a professional network, that you do need to actually set expectations even with regards to time, and also recognize the fact that the other person might also have some time constraints. So what's the best way to work that out? So like I said, it doesn't just happen out of the blue. There is some effort that goes into that, and you need to be willing to put in the effort, but the reward that you get from that is exponentially higher. So it's a good effort to put in.
Thank you so much. Thank you so much, Dr. Hardik, Dr. Kavita, and Dr. Sachin for being here with us. I'm sure that your, in-depth insights around networking and partnership must have tickled the young minds out there, and they would start putting some efforts around networking and partnership in their career. Thank you so much for being with us today.
It's been a pleasure. Thank you so much for inviting us.
Thank you, Ashish. Thank you,
All the
everyone.
best.
Bye-bye.
With that, let us now move forward to our next part of the agenda, in which we have invited students who recently did their internship from AstraZeneca. And we would see what was their overall experience. And at the same time, we would also hear from Dr. Saloni Garg, Regional Medical Advisor, AstraZeneca, who once did internship with us and now is on a trajectory to move to an above country role. Let us welcome onto the stage Dr. Aishwarya, Dr. Sharika, Dr. Shweta, Dr. Simran, Dr. Jinay, and Dr. Saloni. Dr. Aishwarya, my first question is to you. As AstraZeneca medical intern in medical affairs function, can you describe a memorable moment or experience that had a significant impact on your understanding of pharmaceutical industry?
Hi, am I audible?
Yes, Aishwarya, you are.
Thank you so much for that question, Ashish sir, and I would like to answer that in two parts. Firstly, good afternoon, everybody. I'm Dr. Aishwarya. I'm a third-year postgraduate student currently. To start off with, I'd like to say that my experience as an intern at AstraZeneca was a journey of contrast as I transitioned from the bustling PG room to a serene silence of AstraZeneca's workspace. So for me, the most transformative moment at AstraZeneca wasn't in the cubicles, wasn't at the conference room, but it was on a windy terrace with a refreshing cup of green tea along with my co-intern and Dr. Anil, who is the VP currently, and his words about AstraZeneca's mission beyond the profit. It was a small story about osimertinib, goes by the brand name Tagrisso, which happens to be AstraZeneca's blockbuster drug and the game changer for cancer patients that truly struck me. It was the relentless effort of their accessibility, that is their story about how they went on to procure the CGHS approval, to advocating for its broader use, in order to ensure that the people who really needed them the most actually got these drugs. So that kind of redefined my understanding and changed my perspective of the pharmaceutical industry and the impact that we can have on life that is over and above our corporate roles and responsibilities. That's one thing that changed my perspective because before the internship, all I thought pharmaceutical industry was about drug discovery and development and then pushing that drug into the market. So for me, that was a very mindset changing conversation I had with them. And another key take for me was how you can ditch your comfort zone and also learn to ask questions, be bold. Even though your answers might ruffle the feathers, do not get away, and please try to embrace the contrast, the challenges, and the unexpected turns. To end my talk, the most memorable moment was with my co-intern. where we had a little brainstorming session for each and every other project. Like we pitched in for each, every time somebody got a project, we sat down together, we brainstormed about the ideas over the little tea breaks and stuff like that. So the shared learning I had with them was the most memorable for me. And I thank my co-interns for that. And I'd like to end my talk by thanking AstraZeneca for this wonderful opportunity. And also a quick pro tip for everybody who's listening to me. Remember, the future of healthcare isn't just built on breakthroughs, that is newer drugs in development. It's also shaped by passionate hearts. That is, we also always need to take care of our patient outcomes, right? And the unwavering voices that dare to question and challenge the status quo. So let's all try to rewrite the narrative, go forth, be bold, and change the world one molecule at a time. Thank you so much. That's my experience.
Ashish, you're on mute.
Apologies, perks of virtual scenarios. Thank you so much, Dr. Aishwarya, for being with us today and agreeing to share your insights around your experience with internship in medical affairs with AstraZeneca and how it actually added value to your professional aspects that are in place. Dr. Sharika, I would come next to you, and my question to you is, can you share an anecdote from your internship at AstraZeneca Medical Affairs that stood out to you and helped shape your perspective on intersection of medicine and industry?
Thank you so much, Ashish, for the question. Good evening, everyone. I'm Dr. Sharika. I'm a junior resident at CGS Medical College in KEM Hospital in Mumbai. First of all, I'd like to express my gratitude to the PHARMASTEER team for providing this opportunity for me to express my experiences during the summer internship program at AstraZeneca Bangalore. I was under the mentorship of Dr. Apeksha Bhandari, who is currently the Medical Affairs Manager in the therapeutic areas of hematology, oncology, and rare diseases. Now, an anecdote that actually helped shape my perspective was provided by Dr. Anil Kukreja, sir, who is the Vice President of Medical Affairs and Regulatory at AstraZeneca India. So over the course of our internship, we had the privilege of interacting with Sir, where he really brought to light the key role played by regional medical advisors in shaping future policy decisions. He had used the anecdote leaders of tomorrow and visionaries to actually highlight the poignant questions posed by regional medical advisors during their KOL interaction sessions, which play a very critical role in understanding the unmet need in a particular therapeutic area. Sir was also extremely enthusiastic and he encouraged us to think beyond the horizons, to think outside the box, and to come up with really innovative solutions to challenges faced by the medical community. Overall, it was a very wonderful, eye-opening experience for me, and it actually gave me very key insights into the industry and the thought process that goes behind shaping a leader. Also, I'd like to really thank Aishwarya for her insights into her experience as well, because I actually share quite a lot of what she, the entire experience of all of the interns brainstorming on particular projects. That was also a very memorable moment for me. So thank you for bringing that up, Aishwarya. Thank you, Ashish.
Thank you so much, Dr. Sharika, for being here with us today and sharing your insights. Dr. Sweta, my next question is to you. What specific experiences during your internship with AstraZeneca Medical Affairs do you believe have contributed most to your professional growth in the field?
Am I audible to everyone?
Yes, you are.
Okay, good evening, everyone. And first of all, thank you very much, AZ, for giving me this opportunity to share my experience. So the experiences that I would like to share is, first of all, is like Dr. Aishwarya said, being proactive. There before I came to Asia, I used to be a little hesitant for asking things, for asking for anything. So one thing I learned is like from day one to the end day, you should ask for new projects. You should ask your co-interns what they are working on, because that is how you learn new things. And there's no shame in asking, and you need to give up your hesitation. And it is okay to be wrong. And I think the second thing I would like to say is it is possible that at one particular point, you can be working on multiple projects. So it is necessary that you set your own deadlines other than what your mentors have given it to you. And that is not just to impress anyone, but it gives you a different level of confidence. You get that buffer time before you submit your task or project. So these two things are like very, very important that I would like to say, the experiences that I've learned, and I am applying that in my knowledge and my practice now.
Thank you so much, Dr. Sweta, for being here with us and highlighting that how this is actually contributing to overall growth in terms of medical affairs. Dr. Simran, in line with the same, I would like you to reflect on a particular situation or a project during your internship at AstraZeneca Medical Affairs that challenged you and ultimately enhanced your skills and knowledge.
Hope I'm audible to everyone.
Yes, you are.
Thank you, PHARMASTEER team, for providing me this opportunity. I'm Simran Khatri. I'm currently working as a junior resident in St. GS Hospital, and I had the wonderful opportunity of working as a summer intern in AstraZeneca under the mentorship of Dr. Akshay in the therapy of GI oncology. And as my colleagues wonderfully mentioned about the great interactions we had there, along with the interaction and perspectives about policy changing and policy. And along with that, mentors and other facilities, I would like to elaborate on one particular incident where my mentor had given me a task of preparing a short presentation, and I had to cover a lot of information and I had to speak about that information within a span of 10 minutes. And I was very anxious because there was a lot of information that had to be provided in a very short duration. And as I'm famously known in my graduate days and amongst my faculty that I have a tendency to elaborate a lot and I have a tendency to speak for a longer duration. So I was really anxious about that task, that how do you sum up that information in such short duration of time. But when I did that presentation and I was able to do it within the short period of 10 minutes, and at that time I realized that when you put your mind into something and only when challenges are given to you do you completely realize your potential and do you completely realize that how much you're able to do. And it's only in the face of adversities, and these are the same challenges and adversities you face during your drug development. There are a lot of opportunities that come your way, but there are a lot of adversities and challenges that also come during your way of drug development. And we used to have a lot of celebrations at that time in AstraZeneca about certain drugs that had done phenomenally well. So I remember one celebration where we were talking about a drug that had done very well in the therapy area of breast cancer. And as the therapy lead was discussing about the drug, he mentioned that before that drug was launched, the 5-year survival rate in breast cancer was less than 20%, and now it has risen to approximately 45 to 50%. And at that moment, I was so happy and so proud to be a part of a process of a team whose collaborative efforts is leading to such a huge change in the therapy area, in patients' life, in improving patients' life, in improving the survival rate and affecting the quality of the life. Because when you meet a clinician and when you ask about your drug or how your drug is performing, and when you hear those two sentences that your drug is showing promising results in that therapy area and the patient his quality of life has improved, his survival has improved, he's happy, and the patient's family is also doing very well and they are very hopeful, those two sentences, they just make your day. They just make you realize why you are here, what you're doing, and why you're putting so much energy, so much time, and so much resources into that particular therapy area or particular drug. So all of it makes a lot of sense when you hear it, when you see the results, when you see the overall survival improving, when you hear the patient's story about their quality of life being improved to 100x level as compared to what it was before your drug. So all in all, it was a very insightful journey, and I'm really thankful to AstraZeneca for providing me with this wonderful opportunity and their great drugs in pipeline and the promising results that those drugs are showing is all because of that collaborative effort, the hard work, and the teamwork that the company is doing. And I'm really grateful to be a part of it for a short period of time. So thank you. That was my experience with AstraZeneca.
Thank you so much, Dr. Simran, for being here with us today, and that too on a very short invite. Dr. Jina, I would come next to you. Can you highlight a meaningful encounter or a project from your time as an intern at AstraZeneca Medical Affairs that exemplifies the practical aspects of working in a dynamic sector?
Thank you so much, sir, for inviting me. Thank you so much to the team. I am Dr. Jinay Mehta, third year resident in Jawaharlal Nehru Medical College, Belagavi. So, in the internship period, we had many projects that we worked upon, but I would like to specifically talk about a project which is quite interesting, that is iDetect, which we learned about the detection of COPD and how its application can lead to increase in the detection as well as reduction in the exacerbation and increase the management of COPD in a better manner. So that was something which I thought a very short project can lead to such a big impact towards patients' life. Not only the detection and exacerbation, as it is one of the most common cause of death in India. So how this tool, how its implementation can lead to better management of the same, and its real world evidence can be easily seen, is something which is very interesting project which I encountered in the internship journey. Thank you so much.
Thank you so much, Dr. Jinay, for being with us and sharing your experience. The overall idea, in terms of calling you onto the stage, is just to showcase to the wider audience the essence of what value addition that medical internship does in our professional aspects. Thank you so much all for being here with us. Thanks a lot. Let us now invite on stage Dr. Saloni Garg, Regional Medical Advisor, AstraZeneca, to share her experience in terms of her journey she have had till now with AstraZeneca. Dr. Saloni, over to you.
Thank you, Ashish, for inviting me to PHARMASTEER yet again. I think PHARMASTEER is home for me. It's where I started my journey of the industry, and where I am right now is I would not have thought that I would be sitting here talking to everyone, all the postgraduates attending this. So thank you so much for this. How my journey has been, I would start back in 2020 when PHARMASTEER, the first PHARMASTEER was launched, and I was confused as to what exactly will this be offering to me. But yet again, like I was in PG and I still am, I just go for it. I think a little, but if I don't get an answer, I still go for it because I believe that it's better to experience something and rather than not experiencing and then regretting it later on. So in 2020, PHARMASTEER happened. The most important and thing that I was looking forward to was the internship. And I never thought that I will be getting a spot in AstraZeneca, frankly, because it was a competitive online exam that we were supposed to give. And to my surprise, I was able to clear it. And then there was an interview round. And then I was like, definitely, I won't be able to clear the interview. And yet again, I was able to clear the interview. And so my entry into AstraZeneca began in 2021 when I did those 2 months of internship. And like all the interns have shared their stories, I also had a similar experience. I was working with a trials and publications team at the time, and I was working on different things, informed consent forms, real world evidence studies, phase 4 studies, and so on and so forth. But the most important and the highlight of my internship was definitely a session that I had taken for the entire medical and regulatory affairs team, a Socrates session. And it was all because of Amit sir at the time, who was my mentor and guide, and who pushed me to put it. And I took that session. I did not know what kind of ripple it would create after I had taken that session, but thankfully that happened. And the other important highlight of my internship was that there was a constant guidance I was getting from everyone in the team. What corporate life is, why are they, because for me, every day when I get up, I need to be able to look forward to something. And because we are in academia since 10 years, like for 10 years, 5 + 3, or for some people it is an extra drop year, we don't really know what happens in the corporate world. And we are in a bubble. We don't know. So that internship really broadened my mindset. It help me understand what exactly we are doing, what exactly people are doing in the corporate world, and with the right mentorship that AZ provides. So many people with different cultures and diversity giving you those impactful insights to be able to help you take the right decision for your career was really helpful. And within those 2 months, I decided that I will come to medical affairs after I complete my PG. And in 2022, as soon as I graduated, AstraZeneca was my first go-to place. I was like, no, is there a vacancy or not? And I applied for it. I got through the interviews and I became a regional medical advisor. That's when the actual work began. That's when I started, working in doing the field work and all the other things that we are supposed to do as part of our job responsibilities. And it felt like home because the very first day I remember, like Dr. Anand has been mentioned quite a few times, I met Sir and he was like, welcome back to AstraZeneca. And there were many other people who did remember me. And I was surprised that even after a year, everyone remembers my name. And it was all because going back to internship, I was able to take that Socrates session, and I probably left an impression that people remembered me. And so 2022, my journey began in a uro-oncology portfolio as a regional medical advisor, taking care of the South Territory. And from there, I slowly and steadily took small steps. I did not took a leap of that, this is my aspiration and I'll do this and I'll do that. And I'm grateful that I had great mentors. Dr. Mangesh is one of them who, took really great care of properly guiding me from the very beginning. I remember he mentioning, no, don't take it very fast, be slow, take it at your own pace. And I think that's where the confidence came. And I kept on working towards it. I kept on talking to people, and without realizing, I was gaining a network of mentors and friends who were so helpful, so supportive. Any problem you have, you talk to anyone in the company, and there will be a solution waiting for you on the other end. So that is the kind of place that AstraZeneca offered me, and I never felt pride of speaking my mind. The company allows you to speak your mind. The company allows you to be, go and achieve your aspirations. And I think it was after some 9-10 months that I again spoke to my mentor. I spoke to Mangesh that my aspiration is to go global. What do you think about this? I know it's too soon for me. So it was a very unexpected reply that I heard from him, and he said that go for it, why not? And I was like, okay, I can apply for it. Is that a possibility? So he's like, of course, you want to do something, the company will support. So apply for it, give it a try. And frankly, I was not expecting that I will be able to go, clear the interviews, etc. And I applied for an internal job posting, and it took, it's a process. You have to go through all the processes, and there were 3 rounds of interviews, and after those 3 rounds of interviews, to my surprise, I got a call from the HR of AstraZeneca Singapore that you are through and we are moving forward with the next steps. And I could not believe it, to be very frank. I remember calling up Mangesh sir and telling him that, sir, it's, I'm through. And he was like, oh, that's excellent. That's the first thing that he said. But it took me a while to really take a step back and understand why did it happen, how did it happen. And it all goes kudos to the entire AstraZeneca medical oncology team that I have been part of. They have been the most supportive people, and I think my team was more happier than I was when I went through and I thought I was able to clear the interviews. So we call AstraZeneca as a great place to work because it is a great place to work. There is no second thoughts about it. It motivates you, it provides you the right guidance, and it's just not all the, it will also tell you where you're going wrong so that you can improve yourself. If I am not able to, I will be able to understand where I'm going wrong, and they do correct you in that. So that's the kind of environment I think we all look forward to. So I would just like to, conclude my journey by saying that whatever, since the networking partnership, it requires everything. There is not a single, that these are the things, and if you do this, it's gonna work out for you. There's a mix and match of everything. You need to network properly. You need to be collaborative. You need to understand what is right for you. I remember when someone asks me that, whether we should go for the internship or not, or whether we should enter medical affairs or not, my first answer to them is, if you don't experience it, how will you know it? Take that experience and then take a call whether you are suitable for that role or not. So I think we really need to understand what we want to try is first thing, and then take it from there. And I was clear that I wanted a work-life balance. I wanted to be able to work in a country outside of India someday. And I was slowly and steadily taking those steps, understanding my strengths, my weaknesses, how I can work through them, and then talk to people, take the support, and there's nothing that no one can achieve. So just go for it and keep learning. Last year also I said the same thing. So learning is a constant, and we are always in that mindset that no, I know everything. I mean, people are generally in that mindset that we know everything, but we should not be in that mindset. We should always be in an open mind to learn every single time. So that's it from my end. And if there are any questions, happy to answer.
Thank you so much, Dr. Saloni, for being with us here in day 4 of PharmaSteer 2023 and sharing wonderful insights on your career journey over here in AstraZeneca, which I'm sure must have actually motivated the team out there. Thanks a lot for that. I do have one last question, and for that, I would require views from each and everyone in the panel right now. And the question is, since we are sending assessment for the internship tomorrow, so on Monday, so what would be the piece of advice to all those who are actually interested in giving the assessments? And I would like to start with Dr. Aishwarya.
Am I audible?
Yes, you are.
It's a lengthy assessment, so do not waste your time thinking or brooding on certain questions. If you do not know, please go ahead to the next question. Yeah.
Thank you so much, Dr. Aishwarya. Let me take a quick comment from Dr. Simran. Anything from your side?
Yes, to all the candidates who are appearing for the assessment test, I would just like to say, please stay updated. Please advance your knowledge on the recent advances and the drug developments and the recent drugs that have been launched. Just read a little on it and be confident and be logical about it, and read a little about conflict resolution. And just stay confident and stay active and alert during the assessment.
Thank you so much, Dr. Simran. Dr. Sharika, anything from your side? Any final words of guidance to the students?
Yes, sir. First of all the best to all the candidates appearing for the exam. I would just like to say that portray your true self. The exam, it's a lengthy process. It's very time consuming. Make sure, like Dr. Simran said and Dr. Aishwarya said, you're up to date on all the recent advances and you have a general overall understanding of everything you've learned throughout your curriculum. And that should help you during the exam. Thank you so much.
Thank you so much, Dr. Sharika. Dr. Sweta, anything from your side?
Yeah, so if you guys have attended all the sessions, all the PharmaSteer sessions, taken down some notes, make sure you go through them before you go for the exam, and stay hydrated, stay glycemic, because it is a lengthy exam.
Thank you so much. Dr. Jine, any final words from your side?
Yes, as my co-interns have already mentioned all the points, I would just like to reiterate them and say that you write the exam in a very fresh mind and don't waste if you are not able to answer a question, just move on to the next, because it might happen that you are not able to complete the assessment. So make sure that you are able to complete it and not waste too much time in a question. If you're not quite sure about it, you can maybe go back to the same the end. Thank you so much.
Thank you so much. Dr. Saloni, I would ask the same question to you. Any words of wisdom for the students out there?
I'm not sure that the exam that I give is the similar kind, but I would say one thing, be confident about yourself. We end up surprising ourselves also with my own experience. So just be confident and go for it. It's just a exam, so it's okay.
Thank you so much, Dr. Saloni. Thank you so much, everyone, for being with us today and sharing your thoughts and motivating our team out there. Thanks a lot for your presence over here.
Thank you for
Thank you.
having us.
Thank you so much.
Thank you so much.
For having us.
Thanks a lot. Let us now move forward to one of the most important parts of the day, and which is internship assessment as well as the poster presentation rules. The rule number one is the online assessment will be shared to you on your emails on 19th of December 2023. The students who are eligible and are interested in doing the internship must complete the assessment on or before 26th of December 2023. The students who are not eligible per their college or university requirements for the internship can participate in the poster presentation. All the students will receive topics for the poster presentations along with the guidance on 19th of December itself. The last date for submitting the posters is 5th of Jan 2023. With that, let me now reiterate the rules once again for the benefit of all. The online assessments will be shared to all on emails on 19th of December 2023. The students who are eligible and are interested in doing the internship must complete the assessment on or before 26th of December 2023. The students who are not eligible per their college or university requirements for the internship can participate in poster presentations. The topics and the guidance for the posters will also be sent on 19th of December 23. The last date for submitting the posters is 5th of Jan 2023. So the emails for both posters as well as the assessments will go on 19th of December 23, and the last date to complete the assessment is 26th of the December. Last date to submit the posters is 5th of Jan 2024. So that is all from my side. Let me now invite Dr. Sandhya Kamath from St. GS Medical College and KEM Hospital, Mumbai, for her vote of thanks remarks. Ma'am, over to you.
Just give me a minute. I was under the impression that Dr. Anil would speak. But sorry about that, and thank you, Ashish. Good evening to all the AstraZeneca team and my dear students. It is time to say adios to all of you as we conclude PharmaSteer 2023. However, no program is ever complete without expressing gratitude to the people who made it happen. Hence, it is with great pleasure that I take this opportunity to thank all the front and backstage workers who contributed to the success of this program. On behalf of the Department of Pharmacology and Therapeutics, I would like to first thank our Dean, Dr. Sangeeta Rawat. This program would not have materialized without her support. I express my sincere, deep gratitude to all the speakers from St. GS Medical College and Tata Memorial Hospital and from AstraZeneca, who spared their valuable time to share their thoughts with you. We hope that through their talks, you have not only gained an insight about your future professional journey, but also learned the importance of networking, an important program today, and preparing for an interview. Wonderful talks today. I express my sincere thanks to Dr. Anil Kupreja. The interns have spoken highly about him, Vice President Medical and Regulatory Affairs at AstraZeneca India, for his active involvement in planning the program along with his talented team. I would like to thank each and every member of this team, Mr. Amit Kumar, Trials, Publications and Medical Excellence Lead, Dr. Mangesh Kambe, Therapy Area Lead, Oncology and Asia Area Women, Cancer Medical Therapy, Mr. Mohammed Mansoor Hussain, Associate Director, HR Business Partner, and Mr. Ashish Kumar Dubey, the one who's been speaking to you all along, your host, and who's the Manager Medical Excellence. All of them, along with that team, were instrumental in crafting this program. A heartfelt thank you to Mice Ideas, the event management company, for managing the virtual Zoom meeting so efficiently. And last but not the least, I would like to thank Dr. Viraj Radha Daksha, an alumnus of our department and a dear friend. He's the Area Medical Director, Middle East and Africa at AstraZeneca, and it was he who first approached us with the idea of an academic industry collaborative workshop for postgraduates with a focus on medical affairs. And hearing the interns today, I'm so happy that we went ahead with this workshop. And finally, a big thank you to you all, dear students, for your keen interest in the workshop. I'm sure that this has been an enjoyable and enriching academic feast for you. For me personally, PHARMASTEER is a great learning opportunity to know more about next-gen medical affairs. The role of the pharma industry, as you all know, in addressing public health challenges and its efforts in elevating patient safety and providing access to medicines for rare diseases are heartening to know and support our belief that patient is the focus in the pursuit of science. Dear students, we look forward to your feedback. Like every year, the feedback will be analyzed and your suggestions will be followed while planning the next year's workshop. I take this opportunity to wish all of you a great new year 2024. Thank you once again and goodbye.
Thank you so much. Sandhya ma'am. Dr. Anil was just involved into a parallel program, and he's now joining in a moment. Just give me a second. So he would also have few words to share, and he would be joining in 30 seconds.
You could have waited for him actually, because
right,
because mine was like out of times.
No, ma'am. So he would be here just to thank you, ma'am. So just give me a second.
I'll wait, no problem.
Yeah. So he's just working on joining the things. He was actually traveling and was in international speaker program, but he was so keen to join today. So just give it a few seconds for him to join, ma'am.
The only thing is I wanted him to hear me thank him. That's all.
Right. So he just texted me personally in the back that I would be able to join. So I thought, yeah.
It was really nice to hear the interns talk highly about their internship training program, and also some of them, as Saloni said, PHARMASTEER really helped her. So that's good to know.
So while Dr. Anil joins, let me just ask the students if they have any sort of questions or concerns pertaining to internships or the poster presentation. Feel free to reach out to myself on ashishkumar.dubey@astrazeneca.com. I would be happy to help you and support you on that front. Thanks a lot for the patient hearing and staying with us throughout all the 4 days, and looking forward to receiving posters and the assessments from all. Thank you so much. I think we have with us Dr. Anil. Dr. Anil, we were just waiting for you for your closing remark. And I was just briefing Sandhya ma'am that there was one ISP which was going on in parallel, and which is why Dr. Anil was involved into that. Yeah. Sir, over to you for your final remarks. Yeah.
I think, first of all, thank you so much to you, Ashish, and also to the faculty of GS Medical College. And sorry for 1 or 2 minutes delay. I was thinking that this will go on till 4:45, and I was preparing for the same, right? So it's good to see that the program has ended earlier. I really want to thank, I think, express my gratitude and sincere thanks to particularly Sandhya ma'am and also all the faculty of say GS Medical College, right? They have really worked very hard. They not only brought the speakers from their side, and also to the medical excellence team, Ashish, to you, as well as and everyone who supported to get our AstraZeneca speakers and the faculties, and including the external speakers as well.
I think there might be some network challenge with him. Yeah, he's back.
Coming from the faculty, I'm sure medics will and we will continue. Mostly, it's very important for us to ensure that we, whatever learnings we are there, we implement in the actual daily life. So as you improve on your examination, as you pass your examination, I'm sure this would at least activate your brains on what happens in pharma industry, what's the role of pharmaceutical physician, and what are the various themes and the topics and the capabilities which are required to work upon to once you enter into the pharma industry. So I think this kind of the objective is to give a orientation and overview.
Have we lost, sir? I think there are network issues at his end. So.
Was I audible, Sandhya ma'am?
No,
we lost you in between,
we
sir.
lost you
We
in
lost you in
between,
between.
Okay, sorry, no problem. So I think I just wanted to really thank Sandhya ma'am, to you, as well as the entire faculty from SGS Medical College, right? Gratitude to you. I think this has been a continuous program every year, and it has not only developed the capabilities, but people have really appreciated this program as well. So thank you, sincere thanks from our side, and thanks Ashish to you and the team as well, who brought this together.
Yeah, it's 4 years now, and we're hoping we can do it next year again. And the interns spoke very highly about how you guided them and how you mentored them. So that was very nice to hear.
Thank you, ma'am. Thanks a lot. Really appreciate it.
Thank you so much, Dr. Anil. Thank you so much, Sandhya ma'am. I think we can actually call it a day now, and looking forward to further collaborations with in future coming years. Thanks a lot for all the help and support from your side.
Yeah. Goodbye to all the students.
Thank you.
Thank you, Dr. Anil.
Thank you, students. Yeah, thank you.
Thank you, students.
Thanks a lot, ma'am.
Thank you.
Thank you, Dr.
Sorry,
Anil.
I was not able to
Ashish.
see
No.
Rakhi ma'am and Dr. Padmaja ma'am. Thank you so much. Huh? Sorry, it was not possible because I've joined from my small device.
No, not at all.
No, sir. You're most welcome, sir. Thank you for everything, sir. Thank you.
Yeah.
Thank you.
Thanks a lot. Really
And
appreciate
very
it.
happy New Year to all of you. Happy New Year to all of you.
Yes.
Yeah, in advance.
Yes, yes. Happy New Year to all of you, sir.
Can we leave now?
Yeah.